Hello, everyone. Warm welcome to you. Today is the 8th of March 2023, and it's International Women's Day. So, today we have a special live session to celebrate women in immunization. See you soon.
Let's begin.
Hello, everyone, and warm welcome to this special live stream. Today is the 8th of March 2023, and it's International Women's Day. And I want to start by wishing a happy International Women's Day to all the women out there who are celebrating, and most especially to the women who deliver vaccines. So today I am here with Reda Satke from the Geneva Learning Foundation, and I myself, I am Shalon Bu, all the way from Ebolova in Cameroon. And Reda has joined me today to ask me a few questions. Hi, Reda, how are you doing today?
Of course. Thank you, Charlotte. And actually, we're going to ask, so we have several members of the collective of women who deliver vaccines in the room with us. We hadn't planned it that way. We sent out a message this morning, thought it might be nice to hear their voices, even though you're going to hear their voices, because this is a very special broadcast. This is the first time that we are sharing 5 events that have been led by women who deliver vaccines for International Women's Day, but also on other occasions such as Teach to Reach. I'd like to welcome Dr. Satabdi Mitra from India. Satabdi, warm welcome to you. Are you able to speak to us? We'd love to have you on video as well, if that's at all possible. All right, let's see if we replace the spotlight. Okay. And all right, a warm welcome to you. Please do introduce yourself.
Hello.
Yes.
Good morning, good afternoon, good evening to all of you. I am wishing, first of all, the happy Women's Day. I'm Dr. Shatabdi Mitra, currently working as Assistant Professor of Community Medicine in KPC Medical College and Hospital. We are working here along with the vaccination, with the numerous activities, but vaccination is coming in one of the forefronts among them. And currently we are working with the challenges we are facing with the MR vaccines, and also with the adult immunization. It is also one part of immunization. So here I am, and I have learned a lot from the Geneva Learning Foundation under aegis of Dr. Reda and Charlotte. Thank you.
Thank you, Satabdi. And this is the call. What I'm sharing on screen now is the call from women who deliver vaccines for the world's first Immunization Agenda 2030 movement, Remote Coffee, to meet, network, and learn for International Women's Day. So, Satabdi, we're going to ask you to explain what exactly that means, because unless you have been, as you have, you and many other 1,750 women health professionals from 99 countries have been participating, but many of your colleagues, sisters, have not yet joined this movement. So we're going to talk about what that means exactly. I'd also like to invite you to look at, if you haven't already, the International Women's Day event organized by women who deliver vaccines in 2022. We'll be resharing it today, but we're going to talk about it. And then also in today's, actually this is, let me go to the Geneva Learning Foundation's Twitter. You can also find on LinkedIn, on Facebook, some beautiful paintings as well as quotes from many of the women who deliver vaccines in both French and English. So for example, Uju Igweoku, who says, "I want to remind every woman that they have the power to make a difference in their own lives and in the world. Your voice matters." So now back to you, Satabdi. What does it mean to be a woman who delivers vaccines?
Yes. For vaccination, women play an important role for last many years. It is not only India, it is all over the world. That is, many of the diseases have been eradicated. And for this, the women have fought a lot. Under even the adverse circumstances they have walked during the disasters, when there was the waterlogging, the roads are not in good condition. We have seen that our workers are everywhere, they are reaching and they are giving the vaccines, and they are providing the other healthcare service provisions to their children. So they are not for, especially in India, I have seen that the males, they play the very little role, because our health assistant males, females, uh, they are not the health assistant males, they are actually the dying cadre. The health assistant females are the mainly working, who are our frontline workers. And so women are working really from the front. And we have so also the responsibility and to honor them, to acknowledge that they are their work. And in the last World Health Assembly also, our ASHA workers, accredited social health activists, they were felicitated. Their work was acknowledged. So it is our responsibility, it is the responsibility from all kinds of the healthcare service providers to acknowledge them, to give them the actual honor, not only on the Women's Day, but throughout the year.
Thank you so much, Dr. Satabdi Mitra from India. You are a leader, one of over 10,000 in the movement for Immunization Agenda 2030. You have participated in a number of activities offered through the Geneva Learning Foundation. One of them is called a remote coffee. So those who are not familiar, who have not experienced a remote coffee, may be wondering, what is that exactly? This is what is happening this week and next week around International Women's Day. But first of all, what is a remote coffee, Satabdi?
Yes, I have participated in a number of the events of the remote coffee, and it is actually so nice, so funny, and so actually interesting. We have enjoyed a lot. We have got fun, and we have got interaction with the number of the women. Number of people actually in the remote coffee I have participated in. Many of them are the general events, participating both the males and the females. We get in contact with them. Basically, many of them have been our friends for till now. And we have interacted on the events they are going through, the hurdles they're facing. Many times we have found that the same thing, the same hurdles are everywhere. That was not sometimes known to us. The problem we are facing, say, I was working under the project that is the for the missing of the zero doses. And one of the colleagues in the remote coffee from Nigeria, she told that they are also facing the same problem. So that we can come across with them, and also that the how to solve them. Sometimes we get the idea that how they are facing those things, and some steps they have taken to overcome these things. And these things help us a lot. And sometimes we also have some talking among them, among ourselves, that is some good things, that is say we are enjoying the coffee, are you getting the flavor, kind of these things, small and funny little things. And so remote coffee is actually very much enriching thing, I think so. I have enjoyed it also, and my colleagues also. Thank you,
Satabdi. So I have two more questions for you, but just to say, for the women who deliver vaccines who are in our Zoom studio, or those of you who are online, you can already make written comments. And then for those of you who are in the studio, we'll be asking. So Abigail, Halima, Ijeoma, Mary Goretti, Dr. Agudan Majda, Kamisha Shah Kelly, before we kick off the rebroadcast of 5 major events led by women who deliver vaccines. These events have started really on the 8th of March 2021 and are significant. So we invite you to stay on, both to hear the voices today and to catch up or watch again some of the events that have been taken place that are absolutely remarkable. This remote coffee, Satabdi, 1,750 women health professionals from 99 countries are meeting this week and next to share their experience and learn from each other. So why organize a remote coffee for International Women's Day specifically, connecting women with other women who work in immunization?
I think that especially on this International Women's Day occasion, this is very need of the hour, that is a remote coffee, because we can get interaction among ourselves. We can come to know the things what are going on there. It may not be possible for me to come across the problems and the solutions they are facing, they are making for say in Nigeria, say in Ghana, say in the other countries, say in UK. But and it is not always possible to come face to face, so it helps a lot. And in remote coffee we have been helped and facilitated a lot in past also. So it is very important. And thousands of 1050 women, as you have mentioned, Dr. Reda, that is not a small number, that's a big number. That it is very nice to know that they will come to know each other, and in future hope they will work hand in hand, maybe virtual, maybe sometimes face to face.
Thank you,
But
Stabdi.
truly.
Wonderful. And so you participated, I'm showing on screen now, let me see, what the first event that started in 2021 and then 2022. These events were led by women who deliver vaccines. You participated in, I believe, all of them, and we're broadcasting them again today. Why should busy health professionals, men and women, take their precious time to actually listen to the voices of women who deliver vaccines, your thoughts, your insights, your work, the work that you, together with men, are doing to advance gender equity in immunization? Why should anybody bother to watch this when they could be watching a television series or a movie on Netflix or YouTube? What's important here about these events that we're sharing again today?
These things are very much important because we can get experiences from the actual things which are happening, what my colleagues are doing, so that it may help me in future to do my work, to face my problems, my hurdles I'm facing. So these things are more important, I think.
Thank you very much, Dr. Satabdi Mitra. Now we're going to hear from other voices. Please, I'm going to turn to Charlotte. Charlotte, I've been asking all the questions, but this is an event by and for women who deliver vaccines. Who shall we hear from next?
Reda, I'm going to be inviting Mary Goretti. Mary Goretti, I don't know if you're able to unmute yourself. So to tell us what message you have for women today who are celebrating International Women's Day, in particular as a woman who delivers vaccines. So it's great to see you unmuted, Mary Goretti. Happy International Women's Day, and over to you.
All right. I think Mary Goretti. Yes, go ahead.
Your mic is unmuted. I'm not able to hear you. So is it connectivity issues?
No. I suggest, Charlotte, we go to Kemisha Shaw-Kelly. Yeah, Kemisha.
Kemisha?
Are you able to speak to us?
Hi, good morning. Are you hearing me?
Yes, loud and clear. Please do introduce yourself. And as Charlotte said, your message for International Women's Day to fellow women who deliver vaccines and to probably to everyone.
Okay, hi, I'm Kemisha Shaw-Kelly, medical officer of health, program development officer from the Ministry of Health and Wellness, Jamaica. I'm also assigned to the immunization program. I want to wish everyone, and especially our hardworking females, happy International Women's Day. And in terms of the work that you have been putting out, continue to do the hard work. Pray for strength as we move through, especially in Jamaica, with the hesitance we might face. But we know at the end of the day, the results which we are reaping, which is preventing these vaccines causing or vaccine-preventable diseases. Over.
Thank you, Kemisha Shaw-Kelly from Jamaica. We're asking a few of the women who deliver vaccines who joined us in the studio today for their message for International Women's Day. We're about to rebroadcast for the very first time 5 key events led by women who deliver vaccines in the last 2 years, actually, sharing really their experiences, their insights, their building that collective voice that they are working towards. And I believe Charlotte has our next speaker.
Yeah, Ichoma Naji, whose phone is open. Ichoma, warm welcome to you. Please, can you introduce yourself and share your message on this International Day of the Woman?
So glad to be here. My name is Ichoma Naji. I'm a retired director of nursing, public health nursing in the eastern part of Nigeria, Enugu. And of course, I've worked throughout my public health life, delivering, coordinating immunization processes in Enugu State. I must say congratulations to all women in the world for making it thus far. And I must have to remember those women who did this for us before we came up live, giving us those vaccines that made us ward off some of the infections and for us to live today. And I congratulate the women who work in those hard to reach areas to make sure that children, women, men, are able to get the requisite vaccines they needed in spite of the tough terrain, in spite of the conflict and crisis situations in around the world. I may not thank them enough. The passion they've exhibited and the resilience, in spite of all odds. I must thank everyone. From us here in the eastern part of Nigeria, it has just not been easy, but all women, girls who participate in making sure that the requisite vaccines that are taken are given to the people who really need them. I must thank all of them. And I must thank the coordinator of this meeting for making it today. That is a day for the woman in the world. And I'm so glad that we are recognized. And they keep recognizing us until we'll have to sit in that table and our voices will be heard. Thank you so much.
Thank you very much for that powerful message, Ichoma Naji, and all the other women who are able to join us today for this special live stream in occasion of the celebration of International Women's Day 2023. Yes, madam.
Yes, Charlotte, you must not be hearing. We haven't been able to hear you because of the applause and the music.
To me, the applause and the music is even more valuable, especially for the women who deliver vaccines.
All right. So next, I believe Mary Goretti, what you were saying, if I heard correctly, Mary Goretti is back and is now able to speak to us. And then we'll hear from Rohe and Gia.
Yes, Mary Goretti, please.
Happy Women's Day. I'm happy to be here. It's like homecoming. I've been missing for some time, but I'm grateful that women have taken this vaccination issue very seriously, especially with the COVID-19. They learned a lot of lessons and now they have taken it on themselves to ensure that children are immunized. And I'm glad when it started, I was in some remote parts of Kenya. And as we speak now, the routine vaccination is going on, and they're using mobile clinics, as had suggested earlier, so that nobody's left behind. And I congratulate women because we made it known to them that they're the ones who should take care of their children and remind their husbands and the female and the male folks in their compounds and in their villages, and this they have taken seriously. And also, remember earlier I talked about volunteer, and so many young girls have come up to volunteer, including even men. So they work a lot. They work in the community and they ensure that no child is left behind. And this, I'm sure, with after some years, we'll see significant improvement in terms of their lives, and even enrollment in schools, because when children are not taken care of, even their schooling is retarded. So I'm happy with the time. We'll see the fruits, and this is courtesy of Geneva taking us through, and the remote coffees we used to have to share experiences. And I realized that we are all the same in this world. The only thing which is which needs to be improved on is the gender relations in community, where men take it upon themselves also that children are theirs too, as much as women bear the burden or the task of taking care of children. But if it is all together, then we shall get good results. So I'm happy to celebrate the women, and I tell those ones in the medical fraternity to keep up doing the good job, and let us not stop sensitizing males in our community, and also empower women to have the lives of children at their hands, since they are the vessels of life. Thank you, Geneva Foundation.
All right.
So right now we are going to turn towards Rohenje, whose mic is already unmuted. So great to have you with us today, Rohe. Warm welcome to you, and please go ahead, introduce yourself and share your message with women on this International Women's Day.
Oh, thank you so much, Charlotte. Nice to be back again, and nice to meet the entire Geneva Learning Foundation team, you and Reda. We always excited to be with you on the same platform, because it's all about inspiring, learning and sharing, as well as networking with women around the world. So on this great day again, I am so happy and pleased to be sharing my own message. One thing I believe in. Let me just remind the viewers that I am Rohingyai. I'm connecting from Nigeria right now. Yes, so I work as a C4D consultant, that is communication for development with UNICEF. So, and I know that women, in terms of delivering vaccine, they have been doing an incredible job to make sure that they get to the last child. Because come to think of it, if you are sending a messenger to the audience, but when the audience herself become the messenger, then we are hopeful that the status quo will change, definitely. Because we know that women are the centers of development. And my own message and slogan is, there is no better messenger to deliver vaccine than women. And I believe in that. I know that as women are in the forefront of healthcare service, delivering immunization and vaccination to kids, we are very sure that we will get to that last mile, and even cross the last mile and get to the finishing line to make sure that the last child in the last destination is reached, is immunized, and her potentials are fulfilled. So thank you very much once again, and saying a big shout out to all the women around the world, wherever you may be. Thank you, and over.
So something remarkable is happening this week and next. Women who deliver vaccines are connecting with each other through what we call the remote coffee. If you were here in the beginning, Dr. Satabdi Mitra from India explained what is this remote coffee, which enables 1,750 women health professionals from 99 countries who've been invited to meet, connect one-to-one with each other in private to share experience and learn from each other. And this is the first time that we're doing this, and it's being led by leaders of the Movement for Immunization Agenda 2030. Now, we have heard messages for International Women's Day that are coming from women who deliver vaccines. Originally, we had planned to only broadcast 5 key events led by women who deliver vaccines that have taken place since the 8th of March 2021. But it seems, Charlotte, that there is so much excitement in the studio with us that perhaps there are more women who wish to share their messages. Before we start, what was the original plan? Broadcasting previous events, public events, even as this week and next, women from all over the world who deliver vaccines, who work in immunization, are meeting privately to learn from each other, to meet, network, and learn from each other. Charlotte, who are there other voices we need to hear before we hit the play button on these previous events?
I think for the moment, Reda, we seem to have exhausted our list of speakers and those who want to share their messages. But just to say, on our social media channels, handles, you'll get other messages, lots and lots of messages from women who deliver vaccines, the message that they wish to share with their fellow colleague women that are working in different contexts, different system levels around the world. So if you visit the Geneva Learning Foundation on Twitter, on LinkedIn, on Facebook, you will get to see those messages with very colorful pictures, messages from women who deliver vaccines.
That's right. And just type Geneva Learning Foundation into Instagram, Twitter, Facebook, LinkedIn, and you will find an amazing gallery with pictures of families, of mothers, fathers, grandfathers, grandmothers, children together, protected from vaccine-preventable diseases, and quotes from women who are participating in this first Global Health Remote Coffee to meet, network, and learn for International Women's Day. So now we're going to kick off 5 events that have taken place. The first one was on the 8th of May 2021, and it was about resilience during the pandemic. Charlotte, what do you remember was significant about the events we're sharing again today before we hit play on the tape?
Yeah, Reda. So these were quite remarkable events. And talking about the very first one we had that brought together women who had manifested exceptional resilience in the face of the pandemic, coming to share their secrets, coming to tell us their stories of how they continue to work, how they continue to ensure continuity of immunization services during the pandemic. It was just great. And from there, it's a movement that started, it's a collective that started of women wanting to make their voices heard, to share their experiences of the things that they were doing to face gender barriers in immunization, to tackle those, and also inviting the men to support them. And we saw men during these events organized for women by women who deliver vaccines, raising their voice to take up the engagement to support women who are working with them and to encourage more and more women to pick up roles or to give roles of responsibility in their place of work, because they were an indispensable part of immunization service delivery. So I really want to encourage each and every person, if you have the opportunity, to go back to revisit and watch these different events, because definitely there'll be something that will be learned either on how women and what women are doing to solve some of the challenges you may be facing. You may get to learn something about what is happening at different contexts, and it may also lead you to take up, if you are a man, to take up the engagement to support women better as they do the work of immunization. Thank you, Reda.
All right, so 5 hours of events is what we've got lined up for you. Realize we don't expect anyone to watch the entire 5 hours, but just know that this is the collective work, the collective voices of women who deliver vaccines, that and what the dialogue, the exchange, the sharing, the peer learning that has taken place in the last 2 years since the 8th of March 2021. So let's go and listen and learn and continue to do so as we enter the second year of the movement for Immunization Agenda 2030.
Greetings, everyone, and warm welcome to this special event. Happy International Women's Day to all you who are joining us today. I am Charlotte Mbu from the Geneva Learning Foundation. I'm reaching out to you from Cameroon. So today is a special day, and it's the very first time we are holding an event of this type, celebrating the International Women's Day. Today we want to celebrate women who are at the front line, women who are in immunization. They are immunization professionals from the health facility level to the global level, and they are giving in, putting in efforts day in, day out to ensure that immunization services are maintained at optimal level and that immunization performances are improved. During the COVID-19 pandemic in 2020, these women still continue to go ahead and do the work that they are called to do. And I am, as always, in this event with Reda Sadki, who will be, I'm probably sure, in here in the Zoom room with me, the only male. But I also want to especially greet all the women who are here with me on the panel here in the Zoom room. These are women who have shown themselves to be leaders as far as immunization is concerned, because they were involved in the COVID-19 peer hub. That was a community of immunization professionals that was created to ensure continuity of immunization services in the context of the pandemic, and also those who are part of the Teach to Reach global community for action. So I just want to wish you all a warm welcome. And I'm sure if you're joining us from YouTube, Facebook, Twitter, LinkedIn, I encourage you to indicate by telling us your name, your city, your country on the chat so we can recognize you. And from time to time, your messages are going to be shown on the screen.
Thank you so much, Charlotte, and welcome to all. Thank you for being the master or mistress of ceremonies today. We are indeed live streaming this across YouTube, Twitter, Facebook, and LinkedIn. And in fact, the response to this, the announcement of this event has been amazing. Just a couple of hours before the event, we had already reached almost 10,000 people on Facebook. There were almost 500 comments before the event even started, and there's a stream of comments that we haven't even begun to acknowledge yet. I do want to point you, I don't know if anybody's going to be able to copy and paste or sort of recopy this link fast enough, but I'll show you what this is about. This is called a Padlet, and we have prepared 5 questions. Charlotte is going to go through them, and we're going to have a number. There's a small group of women working in immunization who are graduates of the Teach to Reach and COVID-19 Peer Hub, and who are in the room with us, are going to be sharing their experience. But you also get to share your experience. As Charlotte said, there is no expert panel that's going to explain things to you. This is really about sharing experience. You can see there's quite a few testimonials already coming in via the stream. And just to frame this a little bit, this is from a group called Holland IQ, and it was interesting because it brought together the 2 areas where we focus at the Geneva Learning Foundation: the healthcare workforce, which is 70% women, and with respect to education, public school teachers, 3/4 of whom are women. You can see, so both from the education side and the public health side, this is of concern to us for the Geneva Learning Foundation. Charlotte, back to you. I believe we have 5 questions. Could you tell us a little bit about these? And let's dive in and hear from some of the women in the room.
Exactly, Reda. Those 5 questions that we really wanted to get the women to share their experiences of how it is like as a woman in immunization, working in their context, and then look at a little bit about at the COVID-19 pandemic and its impact on immunization services, its impact on the day-to-day working of the work of the women that are involved in immunization services. So basically, I don't really want to talk much, rather. These questions have been shared on the chat. So if you are here, you can just go ahead, attempt answering the questions. And also I'm going to invite, we are going to start with Amel Atai. She's an active member of the scholar community who was actively involved in ensuring that immunization services are maintained in her context during the COVID-19 pandemic. So Amel, if you can unmute yourself, okay, so the 5 questions so that Amel can rapidly go through, because I want to listen to as many women as possible today. So hi, Amel, please, can you introduce yourself? Tell us where you're joining from.
Hello, everyone, and thank you so much, Charlotte, for giving a chance. And very happy International Women's Day to all the women. And we wish the same to Rida and the other men as well. So my name is Amel. I'm from Sudan. I'm working as technical officer with WHO supporting polio program in Pakistan. So today I will, as I'm given the chance, I will go within less than 3 minutes to answer all the questions, so the other colleagues, they may have the opportunity to talk. So looking into the COVID context, when it started, in March, I remember the area where I was based, called Quetta in Balochistan province. And even this picture is showing exactly the polio campaign was going on. Then we heard that the first COVID case was reported in our area. So I do remember we investigated one of the positive polio case, and I met a mother, and she was really, really disappointed because of her fault. She couldn't vaccinate her child. She was refusing for some reason because the husband was not agreeing for vaccination. Then I remember I shared my contact number, and we had deep conversation with her about the immunization and how it is important to protect her children. Then in April, I remember she texted me saying that now there is COVID and my child already infected, and they have another 5 children who are under 2 years old. So she was asking for advice and support what she can do now, because if we remember, I guess in many of the countries, they have shut down most of the immunization centers, especially in those areas where I was working. Then I do remember I called the DHO, the one who is looking after the health system over there, and we start thinking that, okay, since those refusal women now they are really interested to vaccinate and they know that the importance of the vaccination, let's go and just at least in the big hospitals we have to continue our vaccinations, and also putting all the precautions and everything. So that one of the things I was really happy in that time, despite of the challenges we have, the COVID situation, and most of the information was not clear when we started the pandemic. So that was one of the examples, and actually there are many. Just I will take this one. Now moving to the second question. How has COVID affected your daily life? I'm one of those who are really badly affected because I'm based in non-family duty station, and my family is in Saudi Arabia. Then they banned all the flights. I stayed in my duty station for 8 months. And usually in normal situation, we do travel home every 6 weeks. So that was really terrible time for me. But always, Charlotte, I believe that in our difficult situation, we come up with really many lessons learned. I have learned a lot of things. And my personal part of that, professional and personal life, I'm having a child who is 8 years old. So it was really difficult calling, trying to adjust to the situation, and there is no solution. You have to be there. And moreover, I remember I was with 5 international staff. All of them, the 4 were men, and all were aged. So they were above 50. The management, they decided to take them out as medical evacuation, and they said, because you are the youngest one, you have to stay. So that was really difficult. But anyhow, I have learned, I managed, because there is many things. Being a leader also, to lead your own team, despite your own issues, is something really not an easy. I remember when my colleagues, they used to come to me, Madam, how are you surviving? We are men, but we could not manage, and you are not with family. But always, always, if you focus, you put all your issues, you can come through and you will learn many, many things. I would say thanks God now there is vaccine, and
Sorry, Amel, you have to unmute yourself, please. That's great.
yeah, fine. So, Charlotte, the third question, what would happen if you woke up one morning and there were no women working in immunization? So let's not create an issue between us and reader groups. So, but my comment on that question, the immunization I have seen, because I work in my country in Sudan and now the area where I'm working,
Vaccination
I have
starts.
I have
Agency
seen
the most of
the
this is
Please, I'd
sorry.
like to invite you to mute yourself if you're not talking. Sorry for that. Amel, please go ahead.
Yeah. So what I would like to say, women's, they have the patience to work. They are not in hurry like men. And one of the advantage of the recruiting the females, especially in immunization field, I would say is more, really you can get more benefits from that, because they will be able to access the houses in the area where they are some conservative community who are not allowing the males to enter their houses. A female, always my personal feeling, when we see, especially in Pakistan and this area, Afghanistan, whenever I see a child who is really having the polio virus, I do always recall and consider him or her as my own child. So that feeling, the emotional we have as female, I feel it will help. It really it will help. But that does not mean that men, they will not work and all. They are not working. They are very good men, and they are our colleagues and friends and family members. So now moving to the fourth question. Okay, now I'm technical officer supporting, providing some technical support to my own team. If I wake up tomorrow morning and I'm a man, what will be the difference? In my context, the difference will be I will not have the access to enter the houses in the area where I'm based. I'm talking about that practical experience. Number two, one of the advantages, and I feel that is really, it helped me to empower the national females who are working in the area. Always they look at you as a role model for them. You are the one always support and tell them you can do. There is no difference between men and women. You have to do the same job, and always we are emphasizing that since we are working for the UN agencies, there is no difference at all. So if I wake up morning, I will not be happy to continue in Pakistan, because I know this is one of my strengths. Always I do tease my colleagues and say that I'm the best because I feel I can enter all the houses. Over to you, Charlotte.
Thank you very much, Amel. And I'm so glad that in spite everything you went through, being far from your family, you still kept your smile. So keep smiling. And so we are going to move directly and thank you, Reda, for the applause. And I I just want to say we are delighted as women, and I'm sure Amel is delighted to share that applause with the men that are also working in immunization. All right, so I'm going to turn now to Hawa Abbas, who is going to be the next to share her experience as a woman, and she's going to answer the 5 questions. So Hawa, if you can unmute yourself, you have the floor. And the questions are on the screen.
So Charlotte, I've had to remove the unmute possibility from just because there's so much. Let me do that again. Yeah.
Okay.
Yeah. So let's ask Howard to unmute.
Yeah, I'm unmuted. Good afternoon, everyone. Good morning, good evening, wherever you are. My name is Hawa Abbas, as Charlotte said. I am based in Nigeria. I work with an organization called Silver Lining for the Needy Initiative. I'm the founder. So I'm going to attempt to answer all the questions quickly so that others can get a chance. The first question would be, can you think of an individual woman? So there was a lady I met a few years back, and she had lost in a community, rural community, and she had lost 5 children. And I felt like this was a woman who was very strong, and she wasn't educated. And so we had to educate her about the importance of immunization. She had 2 surviving children left. Now, since then, this happened a few years ago, she's been able to be an advocate for us within the community. The challenges she faces, like all women in her community, is that there is no primary healthcare center in her community, which makes things extremely difficult for them because they do not have access to healthcare, access to medical professionals. How has COVID affected them? Again, they don't have access to medical professionals, but they've been able to follow COVID guidelines, wear masks, educate other women in the communities and men in the communities, the importance of wearing masks, hand washing, etc., to be able to ensure that they stay safe. The second question, how has COVID affected your life? Well, I'm a COVID survivor. I had COVID last year in September. From COVID, it led to pneumonia. From pneumonia, I just had to shut down. I'm a workaholic, but I had to shut down because my body just could not take too much work. During COVID, even though I shut down, I still managed to be able to do my Teach to Reach courses as best as I could. Although I did not feel like I gave my best because obviously I wasn't medically strong. Again, with the professional life, it slowed me down a lot because I'm used to going here, working up and down. I was in the FCT task force for COVID. And so I had worked a lot prior to September 2020 when I actually had to shut down. What would happen if you wake up one morning, there were no women in immunization? Well, the first thing we would have to do is advocacy and try and gather women in communities, educate them, and then bring them to immunization, because without women, it's really very impossible to have an effective immunization effort, especially in a space where religion and culture is very, very high. You need women to be able to access other women and the children as well. Question 4, if you woke up in the morning and you held the same job and function, but you were now a man, what would you do different? Well, I will focus on the men. If I was a man, I'll focus on the men, talking to the traditional leaders, talking to the men in the community, the chiefs, the youth. That will be my focus as a man, to get more men involved in immunization so that we can reach more people as well. Because again, in a country like Nigeria, and I'm sure so many other places around the continent, when we do not have men involved, women don't have permission to be able to give their children immunization. They don't have permission to be able to even leave the house. So men are very important. They're key in this struggle and this fight that we're trying to work on. Question 5, would you be interested in taking part? Definitely, I'll be interested. Based on time and schedule, I'll make sure that I make myself available. Thank you very much, Charlotte and Reed, for getting me involved and giving me the opportunity to speak.
Thank you very much, Hawa. It was great to listen to you. And Reda, before I turn towards the next lady that will share her experience, I just want to recognize the presence of Dr. Anne Lindstrand from WHO IVB, and Carolina Danovaro, who are both here in the room with us. So you're welcome, Anne. Okay, so I'm sure in a short while towards the end, we'll have to give you the opportunity to address the women who are here, you who works at the global policy-making level. So I'm going to turn now to Satabdi Mitra from India. India has already introduced the COVID-19 vaccine and has already gone a long way. So I will really be delighted to listen to Satabdi, who was actively involved in this activity from the outset. Satabdi, over to you.
Thank you, Reda. Thank you, Charlotte, and everybody present here. I'm very delighted to be present in this on this auspicious day today. That is the International Women's Day. I would like to tell very few words because one thing that within few minutes I have some other International Women's Day seminar. And the thing that I have one of my colleagues, she is a single mother, and she works hard, and especially during the COVID days, she worked a lot during in my institution. She worked really hard for her institution, for the patients, as well as for the after the vaccine introduction also. And beside this, she, days after days, she could not go to home. Her child, she is a bit mentally retarded, and she stays with her mother. But despite all the things, she could manage. And sometimes we also, from our part, also made contacts with the child, and her mother somehow later on managed to go home. And so for the single mothers, not only for the single mothers, everybody who are the working, maybe some people who are non-working also have to face challenges, not only during the pandemic. Being a lady still now in our society in India, it is very difficult for a woman to manage everything. That is the different adolescent issues, the different womanhood issues, and managing all the things. People have to go and walk forward. And one thing I like to mention that yes, I am always there to be the part of the if any coming on courts involving the females. And I'm also very much thankful to all the males who around us and in the society who help us, support us. So this all from me now. Thank you. Thank you, Charlotte, once again, and wishing happy Women's Day to you and all the wonderful women in this platform, as well as our male colleagues.
Thank you very much. Thank you very much, Satabji, and wish you the happy Women's Day too, and the best with your next call. So before I turn towards the next lady who will share her experience, I'd just like to recognize all of you who are leaving wonderful comments on our various social media platforms. That's Facebook. Reda, can you just maybe read out one or two comments that you find quite pertinent before we turn towards Joyce Murithi, and also those who are answering the questions on
Thanks, Charlotte. It's actually, it's quite interesting. We set up what's called the Padlet. So that's a platform that really lets you crowdsource responses to questions, and everyone can see the questions in real time. So there are many questions coming in here. There's one that really struck me, which was that one person said, COVID-19 affected my daily life and family. I lost my job, no social life for the entire family. Price of goods and services have skyrocketed. Living in fear of the unknown, who to go close to. And this is, of course, an immunization professional speaking. These are anonymous. I think that's part of what we were hoping to sort of instill in terms of people being able to express themselves clearly. Let me just flash the, now it's a little bit, you'll find the link if you look for it in the comments, but there's so many comments coming in, it may be difficult to find this one. It's padlet.com/TGLF/IWD 2021 immunization. I'm so sorry, that's so complicated, but there's some wonderful comments and many people saying hello and sending their greetings for International Women's Day. Back to you, Charlotte.
Okay, thank you very much, Reda. And right now I'm going to turn towards Joyce Murithi. So Joyce, I'm inviting you to unmute yourself and you tell us who you are, where you work, and answer the questions. And by the way, you're looking very good in Women's Day regalia.
Thank you, Charlotte. Thank you, Reda. Thank you, everyone else. Happy International Women's Day. I'm calling from the US, Maryland, and my name is Joyce Murithi. I appreciate the Geneva Learning Foundation having this day to recognize women and amplifying the role of women in global health and immunization, and especially the role that women have played in preventing and controlling the COVID-19. When I think of the first question, can you think of an individual? I have met many women as I participated in the work of COVID-19, self-testing, and vaccination. And some of them are caregivers to their children, others are caregivers to their parents, to their elderly relatives, disabled relatives, and so on. The one woman I'm going to speak about today is a woman who is single. This woman is divorced, and this woman has 3 children. She has a house to pay for and rent, and she's also in charge of her relatives, like I said. She used to have after-school daycare facilities for her children, but with the COVID and the closures, she cannot take her children to the YMCA facility. And now she has the elderly parents at her home. She's going through divorce, she has children. It was very difficult for her. So she has used different resources within her community to be able to help herself to bounce back. And some of her strength is that she's very resilient. She's hardworking, and she nurtures her health and the health of her people. And she's also concerned about the health of her community. So she made sure that everybody is isolated and social distancing and using the masks and all that, what needed to be done. But one of the things that she did to be able to survive during this time was to get one of her cousins to come to her house so that she can be able to continue working. And this other relative can take care of her elderly parents and also her children. This woman also is very compassionate, very empathetic, because she was also caring of her, about her neighbors. She was talking about how she was sharing food with her neighbors. And because I'm in the northern part of the country, it was winter time, she was also helping in removing the snow for these elderly people. So we can see a woman who has a lot of responsibility. And this is not just the woman in this particular part of the world. All over, even in other countries, we have women taking care of themselves, taking care of their own families, and also extending their compassion and passion for ensuring that their communities are healthy and also that are surviving to their neighbors. What I gathered from this woman is that she's a great leader to be able to manage her elderly parents, her cousin, the relatives around, and she's also going through divorce. She must have been a leader. That is what we women are. And this is what we women are bringing into the work of immunization. She's a teacher. She has also been teaching her community, her children, and her family about staying healthy at this particular time. This was an important thing because during this time of COVID, there was so much information, very conflicting. We didn't know what to do. We didn't know why we need to wear masks. We didn't know why we need to keep washing our hands all the time. Sometimes those resources are very scarce. She was an educator. That is who women are in our families and in our community. Even as she tried to do all this, there were challenges. And I probably will talk about challenges that are related to this particular woman or generally for women. We have had so many messages in the social media, and this was a challenge in itself to know what we need to do. Some people are saying we don't need to wear the masks. Others are saying we don't need to do this. We don't need to do that. And it was conflicting to learn or to know what is the exact thing to do. When the vaccine was available, there was a lot of information, different information about the vaccine, about the adverse effects. And these facts and myths were a challenge in themselves. We have culture and religion that also we have had to go through. And I'll talk of a different participant that I met that had challenges with their religion, especially when the vaccine was available. And they were told one of the vaccine is made from, stem cells of, I don't want to get into the details of that, but from fetal stem cells. And these people, because of their religion and pro-life belief, they were affected on how they are going to provide the services, the vaccination. And they felt like they cannot offer that vaccine to the people because their moral and ethical values are not related to what is happening. That is a huge thing, and they had to discuss as a family. It was a family feud because the husband decided, no, it can be done. The wife decided, I cannot do it. And these are the challenges that women go through. I know somebody mentioned about this. Even when it comes to vaccinating our children, they are the same issues we are facing. If my husband does not believe in vaccination, I cannot do it. So as a woman, I have the role of educating my husband, being empathetic, being in his shoes, and trying to understand where he's coming from, and even being submissive so that you can be able to pass on that information to be able to reach the goal. Because women are the antennas of health in their families. So that is an important thing. If you leave your child with your husband and your child starts to have fever, your husband will not know how to deal with it. They will not even recognize. They will not even recognize.
Thank you very much. Thank you very much, Joyce. I see in your responses, you have already started, you said putting yourself in the man's shoes, attempting to answer the fourth and the fifth question. So I really want to thank you. We are already going over time, and there are many other people who want to listen to. So I'm just trying to check if Anne Lindstrand is still with us. Meanwhile, Reda, you said there are some interesting comments that you'd like to share. So over to you, Reda.
Yes, indeed. So we've got, I want to remind everyone, there is the Padlet, which is a little bit complicated to get to, and I think we have to extend, given the number of comments we're receiving, we have to extend this event a little bit. Padlet.com/TGLF/IWD 2021 immunization. Apologies for the very long link, but this is what you will get to. You'll see testimonials from all over the world from women who are responding to these 5 questions, in addition to the people in the room. Now, the 3 comments that I wanted to share is one is from Rebecca Gatu, who says, I salute all refugee and immigrant women who, despite fleeing their countries, have continued to ensure that their children access immunization services. I wanted to highlight Yin Yin Ete, who says, I'm happy to join this wonderful event, especially on International Women's Day. And there are literally dozens of messages like Yin Yin's. Hawa Buhari, I flashed her comment before, but she says, I'm glad to be a woman, one with a voice, and I say yes to immunization and community health. And then Raul Saho, who says, women will always be preferred to offer vaccination services in some communities in areas hit by war or other crisis. Population and parents will have more trust in women than men offering the same services.
Such wonderful comments. Really, thank you. A special thanks to all those who are sharing these comments with us, and also all those who are here in the Zoom room. So many interesting comments on the chat, and I want to share this comment with us from Dr. Annelise Tran, WHO IWD, who unfortunately had to leave. She says, dearest immunization sisters, I need to leave and work on our COVAX work. Fantastic to hear. Fantastic to hear all that which you have to share. And many other comments like hers are so interesting. So right now we are going to listen to another experience from Martha Ngoe from Cameroon. Martha, if you're hearing me, I'd like to invite you to unmute yourself. So let me just invite, okay. Martha.
Hi, Charlotte. Hi, all the women.
Hi, Martha.
Okay, thank you. I'm really happy to be part of. Hi, Charlotte. Please, can you get me?
Yes, 5 on 5, Martha.
Okay, so thank you for giving me this opportunity, and greeting to all the women and also to the man in the room, Reda. Thank you for the opportunity. So going very fast, the kind of woman that I'm talking about today is that woman. I love working in the royal setting, just because I look at that woman who does not know how to read and write yet. She's very, very committed to see her baby receiving till the last shot. So that is a woman who, even no matter the season, be it rainy season or dry season, if the outreach does not fall on a day that her child needs to take the next shot, that woman treks 5 kilometers and beyond just to go to the next health facility to have a shot for that child, because she wants her child to be free from vaccine-preventable diseases. Her strength is that no matter what, no matter her activity, she's in a typical royal setting, but yet she knows that her baby needs to be healthy and that vaccines can contribute to the healthiness of her baby. And the challenges she faces, first of all, the women in the typical royal setting, they are all farmers. They had to leave early in the morning to go to their farms before the sun rises with their babies on their back, and then come back just in the evening and prepare food for the family so that they can have dinner. But on a day like this woman would prefer to forgo her farming work and then go straight to the trek the whole day just to go and have that shot. So it's really challenging for that mother because, first of all, the facility is far away from her, but yet she does not take anything for granted. She makes sure she forgoes any other socioeconomic activity just to ensure that that child receives till the last dose. How has she been affected by the COVID-19? In my own setting, we have a double penalty. It's not just the COVID-19, plus also the insecurity. So there are some times that the vaccines may not be able to reach this woman on time for the time that she's expecting that her baby have the next shot. But nevertheless, the baby may have a catch-up dose, although it might not be at the time that she might want, and this kept the woman disturbed. COVID-19 has affected my daily life and my family because even during the lockdown where the schools were closed, I just had to look at my children around the house, my siblings, and say, what is the future of this generation with the COVID? But we thank God, things are coming back to normal. And for my professional life, I I don't really enjoy staying in the office. I enjoy going to the rural area, to go to the field to see what is really happening there. And because of the COVID, we really don't go all the time to see what is happening there. But we have been working remotely and ensuring that work is going on well. If I wake up one morning, I don't find women immunization, oh, I will not be happy, because women are already peers to other women that they give that shot to them. Women knows how to tell stories. A woman may be discouraged or have a challenge to come for the shot for a baby, but just because another woman is there to tell her the story of how her baby survived because of the vaccine, the shot the baby she gave to her baby, this woman will be encouraged. So we'll always advocate that women should be on the decks because they can tell stories to their fellow women. If I get up one morning and I'm a man, what will be different? I think if I'm a man, I will also advocate for other men to feel the way, although it's nature that has made it, to feel the way women feel for other children, even if they are not their biological children, to feel just the way, because what I feel most when I'm in the field, I feel as if that baby is my baby and it is very important. So I think I will have to feel the same and also encourage my fellow men to have that same feeling. Yes, I'll be interested to take the practical course on that, because I know Geneva Learning Foundation and other platforms, they are there to promote immunization activities, and it will be very interesting for me to take the course. Thank you, and over.
Thank you, Martha. Martha, before you go. So I'll just about to say, Martha, before you go, please, can you just kindly introduce yourself, tell us where you work and what you do.
Okay.
Martha? Yeah.
Okay, thank you a lot. Sorry for not mentioning that. I'm Martha Ngwe from Boya, Cameroon. I've worked with the EPI coaching as a coaching manager, and recently as Bureau Chief for International Vaccines and Traveling Medicine. Thank you, over.
Really,
And we
once
have
again, thank you.
Raul,
Yes,
in fact, thank you, Martha. Raul says, Martha, my colleague, this is the kind of female leader needed to boost the vaccination. Keep on, Martha. And those of us who know her would concur. But don't forget to introduce yourself, as not everyone knows everyone here.
Okay, so we just have under 3 minutes before the end, and I'm looking at so many comments. I don't want us to go without actually recognizing some of the comments that are shared by the women that are here with me in the Zoom room. And I see there is Aminata Nuni that is taking out the time to answer the questions here in Zoom. Question one, she said, I met a woman who is very passionate and determined to ensure that her children get vaccinated. She walks over 7 kilometers to reach the health facility to get her children vaccinated. She's a trader who contributes significantly to the upkeep of her family, but still prioritizes her children's health. And for question two, she says, COVID-19 has significantly altered my daily life, as I now seem to have more work, as we have a lot of virtual meetings to attend, even when you have your routine work to do. Also have to attend virtual trainings, which is just not the same as face-to-face trainings, particularly with internet challenges. So thank you, Aminata. I'm sure you're still typing out the rest of the questions, but I just thought it important to recognize you. And listening to all of the women here today, I think it's important that we should give a round of applause to all the women who have commented. So Sanya, wonderful comments left on the chat, Reda, those who are commenting on Facebook, and who are answering our questions.
Thank you so much, Charlotte. Much to everyone's dismay, we explained, just to explain why we keep even this event short is because we know how busy you are. This event was not a panel of experts. It was a panel of women working every day in immunization. Right now, many of you are involved in COVID-19 vaccine introduction and in keeping immunization services going throughout the pandemic. So a round of applause indeed seems to be less than what we should be doing to honor you. Thank you to all those of you who answered the 5 questions. You are welcome to do so after and beyond this event to keep the conversation going. And the address is a little bit complicated, but it's on padlet.com. We'll be posting it on the social media platforms. I think that is it for now. La séance avec les francophones va commencer dans 15 minutes. With the francophones, it's in a few minutes. Yes, indeed, we'll be sharing the messages in a little bit, doing a little bit of a rewind, not as long as usual. Thank you so much, Charlotte, for pulling this together so quickly.
Thank you very much, Reda. It was a huge pleasure for me to get to share this moment with all of the women that share a passion for immunization like me. And once again, happy International Women's Day to you all.
Warm welcome from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. You're attending, listening to an important historical moment, and that is what happens when 143 women from all over the world who are immunization professionals come together to tell their story and call on other women to share their experience. That's what we're going to be learning about today, talking with Charlotte Mbou and a few of the women from the organizing committee that is preparing this special event. Charlotte, over to you.
Thank you very much, Reda. And once again, welcome to everyone. It's always a pleasure for me to be here receiving you who are following us on our various social media platforms. And as Reda just said, we are here today because we came together as women who deliver vaccines to organize an event around the International Women's Day. That is on the 4th of March to honor and celebrate women who deliver vaccines. They are nurses, they are doctors, they are midwives, they are technicians at all levels of the health system that are working every day to ensure continuity of immunization services in spite of the challenges posed by the COVID-19 pandemic and COVID-19 vaccination. So a number of them are with us here today. They want to, and I'll be turning towards them, Reda, to ask them, to find out from them, why did they decide, what motivates them to come together and organize such an event? So without further ado, I'd like to turn towards Maria Fernanda Monzon. Yes, Reda talked about 143 women from 38 countries across different regions of the world. So Maria is our representative from Latin America, from Argentina. Good morning to you, Maria. You're up early and you came here to tell us what motivates you to organize this event for women.
Well, hello, good morning to all. I am very excited to be here, and well, it's always exciting to participate in any Geneva Learning Foundation event.
Sorry, Maria, can you just start by introducing yourself? Tell us who you are, where you work, what you do.
For sure. My name is Maria Fernanda Monzon. I am from Corrientes, Argentina. I'm a pediatrician. I work in a small health center in the outskirts of my city. So I have a lot to do, of course, with vaccines and their delivery in the local level. So it's exciting to learn always from every single level and from everybody here. So motivations that we were discussing, well, everything motivates you always to participate in these kind of events. This is International Women's Day has a very profound meaning. So it motivates you to go and to learn more, to be mentored by other people, to coach other ones, to gain new experiences. Everything will give you tools to overcome the challenges that are ahead of us right now. So that's mainly the motivation and the excitement that we're looking forward to in a few more days.
Okay, thank you, Maria. Another question for you, a quick one, is who should attend this event? Who should attend this event?
Well, ideally, everybody that is somehow involved in vaccination. In times of COVID, every experience counts. So this is a platform where you get to share them with your colleagues from all over the world. And trust me when I say this, from this country far away from a lot of other people, and you get to learn so much for how people are working all over the places. So everybody should.
So you say it's a special event to honor women. So why should men join to listen to women?
Well, absolutely, they have to be here. And every step of the way for us, for women, we encounter small or huge or problems, difficulties, because we are women. So we need to stop, we need to turn around, we need to find a different path. The idea of men being involved in an event like this is, in my opinion, that we are hoping to be heard. We are hoping to have them recognize our voices, to hear them loud and clear, and to act upon it. So that's about it.
Okay, thank you so much, Maria. Right now I'm going to, and I wish you an excellent day over there in Argentina. I want to turn towards, I'd like to turn towards Satabdi Mitra, that's a member of the organizing committee, representative from India. Satabdi, please go ahead, introduce yourself, tell us who you are, where you work and what you do.
Hello everybody, I am very glad to be here. I am Dr. Shatabdi Mitra. I am working as Assistant Professor of Community Medicine in KPC Medical College and Hospital. It's in Kolkata, West Bengal, India. Actually, it is very much interesting and also a very nice journey for us, that is to be part of the Women's Day, to be observed in the beginning of March. And so for me, that is the main motivation for this, that is the people who are, despite their huge sufferings, they are with us, and in every time during, especially in this COVID-19 situation, they kept their trust, their faith on the healthcare workers who work at the grassroots level. We are only situated, and we are situated in the headquarters, and we are giving them instructions and giving them the advices kind of things. But the actual things, the work is done by our frontline health workers. So the common people as well as the frontline health workers are there, who are working in field. So I like to share the experiences and what I have learned, and I am learning every day from these workers and from these people in serving the community, especially in the immunization services. So that's all from me.
Thank you so much, Satabdi. Judging from your video, I wanted to find out from you, where are you right now?
Sorry?
Where are you right now? I see from your video.
I am now in Kolkata, in my home. It's
okay.
20:30.
Yeah, so it's pretty late in the evening, and you're joining us for this meeting, says a lot. So the last question I wanted to ask from you is, how are you sharing the information about this event? How are you spreading the news about this event? Who are you, those people you're sending the announcements to?
I am sharing the event already. I have shared in my college group as well as among my friends. both the males and the females, so that I have requested them to be part of this and also to spread the news of this event. And now I am also taking part in one fellowship in the palliative care. In this course, in my cohort, there are a number of persons, especially the females are more, around 70% they are females. And here there are the representatives of the different countries, like from Bangladesh, Nepal, Sudan, Kenya, Nigeria. There are many people are there as usually from Nigeria, Kenya. Many people are taking part there. I have spread the, I have shared them with this, that is, and asked them please to come to join there. And
Thank
by
you.
this I have shared.
Thank you so
Yes,
much.
thank you.
Thank you so much. So before I turn towards our next organizing committee member, I'd like to turn towards Reda.
Yes, indeed, Charlotte. First of all, a round of applause for just a few voices we've heard so far. There are many more founders of the organizing committee in the room. And just like to go to, let's see, so I'm just going to acknowledge a few of the people who have, shared messages. So Frank William via Facebook says, "Women are power." That's, yeah, says quite a bit. Frank, you haven't told us where you're calling in from. Please do let us know. Now, Charlotte, you have a francophone friend here. Umar Adoum, who says, "Bonjour, Charlotte." And we have our very own Amel El Tahir, who says, "Greetings to everyone in our beautiful immunization family." Amel, connecting, as usual, from the Kingdom of Saudi Arabia. Welcome to you, Amel. All right, we have many more, I see many more founders of the organizing committee. It's the first time this is happening. 143 women from 38 countries who've come together to speak in their own name about their experience as women who deliver vaccines. Charlotte, back to you.
Thank you, Reda. Towards Binish, that's in Pakistan. I don't know if you're able to unmute yourself so that you can share with us. Binish, I don't know if you're able to speak. If not, I'm going to turn towards Reda. You just mentioned Amel, that is also our representative from of the founding members of the organizing committee over there in the Kingdom of Saudi Arabia. That is the Middle East and North African region. So Amel, are you able to unmute yourself while Binish tries to sort out her connectivity and sound? Okay, Amel,
Well,
please.
Thank you, Charlotte and Reda. I'm from Sudan, but currently I'm living in Saudi Arabia. So thank you very much for giving a chance. You know, it is always honored to be part of such wonderful community. Actually, I would like just to encourage everyone to expand their all networks, to invite everyone to come and celebrate with us. I'm so excited for the event because it is our own as ladies, women, as mothers, and also immunization professionals. And also, I would like Charlotte to pass my message to everyone who listened to us today. Please, 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 don't miss that wonderful event, and make sure that you invite every woman and all the immunization professionals, including men, whom you know within your network, to attend and celebrate with us. I'm quite sure it is going to be such wonderful event. And also, I believe that while you are sending the messages and you would like to invite the people to participate with you, do not miss and forget that the importance of the men. Yes, it is an International Women's Day, but also men are equally important to listen to us, to share while we are sharing our own experiences, challenges, to sending out our messages, because they are immunization professionals, they are They are fathers and they are decision makers too. Also, I would like Charlotte just to brief you. So far, I'm able to invite the EPI officer in the place where I'm living here. It's called Yazan State. And she and her assistant, they promised me they are also going to send the invitation to most of the immunization, because in Saudi Arabia, one of the countries completely absent. I have seen throughout my courses with the Geneva Learning, there is no one from Saudi Arabia, especially in the immunization. And also, I'm able to invite 4 child specialists who are also working here. So also they promise that they will be with us. And the good thing, also I expanded my network to invite some of my Pakistan colleagues whom I always love, and I learned a lot from them. And also Dr. Asia, I think currently she is online with us. And also she is going to invite more so we can help also our Pakistan colleagues too, to make sure that we invite as much as we can. And also I'm working with my team in Sudan, as I shared with you, and also we are going to involve more female. So thank you very much for the chance, and over to you.
Thank you so much.
And thank you, Reda, for the applause.
All right, thank you very much, Amel. Reda, I don't know if there are any more comments from our social media platform.
Well, I think
if
the
not,
best.
we are almost running.
Yeah, the best comments I'm running. I mean, there's lots of activity on social media, but the best comments I see are coming from the room. So comments from Joyce Muriti, who says, when women focus their energy on something, they have passion for it, will succeed. They are trusted voices in the health of their families. I'm honored to be reading this on behalf of Joyce. I hope we'll get to hear from her soon. Eager to hear more voices, even as I believe, Charlotte, we're going over time, so it's your call.
Yes. Yes, Reda, I think we can listen to 1 or 2 more voices. I'd like to turn to Elizabeth Atik Jebe. That is one of our representatives from Nigeria. Elizabeth, please do start by introducing yourself. And there's a question I'd like to ask today. Where are you right now? What are you doing? What were you doing just before this meeting? And then go ahead and tell us your motivation for organizing this event.
Hello, Charlotte. How are you doing?
I'm doing great, thank you.
Great. My name is Elizabeth Atijegbe. I am from Delta State in Nigeria. I live in Benue State in Makurdi. And just before I got here, I had to make sure I got the children settled in after school and then rush to make sure I'm on point for the meeting, if you must know. So my work for the past decade has been as social communication for development professional. And my work basically has been demand creation, social mobilization, supporting UNICEF and implement primary healthcare agencies across the country and other African countries. And it's been a humbling experience, really, traveling to several states, several regions, and seeing women being passionate about making sure that the vaccines remain potent till it gets to the final recipients. So this is an important event. It's heartwarming if the efforts of these women can be recognized. And I want to applaud the Geneva Foundation for putting this program together. Hello.
Yeah, thank you, Elizabeth. And the applause actually goes to you and all the 143 other women that came together to see to it that this event comes to fruition.
Thank you.
Thank you so much. All right, so Reda, I am going to close this live stream with a representative from Egypt, a unique representative from Egypt, Mai Abdallah. Mai, I don't know if you're able to, I hope your connectivity will permit you to be able to speak to us today. I'm inviting you to unmute. Mai, if not, probably Mai is having connectivity issues, then I would like to turn towards Deborah Tembo, that's representing Zambia. Deborah, I don't know if you're able to unmute as well. If not, we are going to close. Yes, Deborah, please, over to you. I see you unmuted yourself.
Yes, hi. Good evening, good morning, good afternoon, everyone. This is Deborah. I'm from Zambia. Right now, I'm working at Zambia National Public Health Institute that is heading surveillance for both diseases that can come up because of people who haven't gotten vaccinated, and also the communicable diseases and non-communicable diseases. I've worked before as a public health nurse, and I've been delivering vaccines in the community. It's a bit of a challenge because you find there are a lot of people that are there, some who deliver from home, and they are unwilling to go to the hospitals to have their children vaccinated. And you see that when you have this opportunity to take the vaccines, even at their doorstep, so that we reduce vaccine-preventable diseases, it is pretty overwhelming. And having this program, having everyone to come on board and to learn from what is going on in other countries, to be able to learn and be able to share experiences, and to know that we are not alone in this movement. There are also other people that are also finding different challenges and also have solutions of how they overcame the challenges. It is pretty uplifting, and it's motivation enough to help us to go ahead. So as for right now, I'm busy sharing. I've shared this message on my social media page, on the pages where I'm part of the nurses movement, the nurses updates. I've shared it, my schoolmates, I've shared it, even on my workmates. I'm pretty inviting everyone, including all my friends in the medical fraternity, that we can really have this program that is so much uplifting, and I'm happy to be part of this movement.
Thank you very much. Over to you, Reda, for the applause and maybe one or two messages on social media.
All right, so we have to wrap up because I know the organizing committee has a meeting to prepare the actual event scheduled for March the 4th. It's already almost 1,000 people who have registered, men and women, Anglophones and Francophones who have already registered for this. So congratulations for this. Obviously, this message, the voices of women who deliver vaccines, is of great interest to many actors in immunization. The announcement has been shared 531 times. And this is the most amazing of all. The organizing committee has shared the announcements, the invitation to this event, Women Who Deliver Vaccines, with 23,546. So please do give yourselves a round of applause as we go to this event. If you'd like to know more, look on learning.foundation. Is the 4th of March. You simply click on the big green button to get your invitations. You simply click on the little WhatsApp icon to actually share on with your friends, your colleagues on WhatsApp. And that's it for today. Thank you and goodbye. Here we are, right on time, 3 p.m. in Geneva, Switzerland. Good morning, good afternoon, good evening, wherever you may be. I am here with Charlotte Mbu, and she is the mistress of ceremonies for this Women Who Deliver Vaccines session. She has not worked alone. She has joined a collective of women she's going to introduce, and then we are going to spend this session really sharing experience together. Charlotte, how are you feeling about this session, and how many of your sisters can you see in the room?
very much, Reda. And once again, warm welcome to everyone to this historic, I call it historic event, because it's the first time we are organizing an event in celebration of the International Women's Day for women who deliver vaccine. We did that last year, but it was just Reda and I who put our heads together. But this time around, we're joined by a collective of 143 women from 38 different countries. And I want to say hello to all of my sisters that are already in the room. I see so many of them are here. And I want to thank them for the great mobilization, Reda.
All right, wonderful. Wonderful. All right, so your first, I was struck when you put together the slide deck for this session, Charlotte. Your first slide asks a harsh question, so we can all read what's on the slide. What does it mean to you?
It's just really about giving voice to women, Reda, because one thing we know is if our health system is moving forward, if immunization is succeeding, it is because there are so many women that are working at the background with the support of men, of course, but are working on the front line at all levels of the health system to ensure that those who need vaccines get them. So I thought it was important that we should come together to honor and celebrate these women, to listen to their stories, get them share their experiences, and why not shoulder their burdens together. Remember, you just said that if we want to walk far, we have to walk together. Thank you so much, Reda.
Right, and the first quote, recognition of women is necessary for the vaccination program to achieve its goals. We'll be sharing some of these quotes, and they are from the organizing committee, as Charlotte said, of 143 women from 38 countries, alumni of the Geneva Learning Foundation's program that have decided to come together to organize this this event. Very quickly, we're going to go check a few messages from the social media channels where this session is being live streamed now. For my Izzat Abdallah, check your email, dear Mai. The Zoom link is in there, but you're welcome to join also to keep watching from LinkedIn. Sharish Shahid from Pakistan, Deepak Kumar Patro, Farhan Ali from Djibouti, and then let's check in the Teach to Reach space itself. We have many introductions, so let's see here. If you're trying to find where this is in the Hop-In space, go to the stage. Samuel Okijiola, greetings to you. Jamilatu Mohammed from Nigeria, happy to meet you mothers with strong heart. Pervaz Youssef from Islamabad, Pakistan. Elizabeth Atijegbe from Nigeria. Joyce Moriti, all right, who says, I can't hear. Okay, try clicking on the arrow button in the middle. That's Joyce from the USA. Bala Mohammed Al-Hassan from Zamfara, Nigeria. Welcome to you. Jenny Sequeira from the USA. Great to join this Teach to Reach event. Ukeme was a community health practitioner, works in a private hospital. That's just a small sampling of who is joining Teach to Reach. Let's go for the second quote, Charlotte. What does this one say?
Okay, thank you, Reda. If we could integrate women at all levels of decision making and give them responsibilities, they would be the best leaders for immunization.
And we have Wenwosan Tekle Mariam Nibabe, who says hello everyone. So tell us, Wenwosan, why are you joining in solidarity with women who deliver vaccines? What do you do? Where are you connecting from? Tell us more so we can include your voice in this remarkable story. Now we're going to dive right in, and we'd like to hear now from women who deliver vaccines and to share your testimonial of your immunization journey. Now, we have, of course, members of the organizing committee who will speak, but we also have many who shared interesting stories. And we first want to understand who you are. Some of you have documented, shared how you overcame a gender barrier, how you faced a gender barrier, something that prevented men, women, girls, or boys from accessing immunization services. So we're going to be talking about those two things, your journey as a woman who delivers vaccines, and then also your story about gender barriers. Charlotte, who is going to be our first speaker today? I can't wait to hear this sharing of experience with women present from all over the world.
Thank you so much, Reda. So my first speaker already has a mic unmuted. It is Maureen Assemble. So I'm going to turn over to you, Maureen, if you can just go ahead and introduce yourself, and then we'll go through the questions.
Thank you, Charlotte. Good evening, good morning, good afternoon, everyone. I'm glad to be here. My name is Morina Sembo from Kenya. Yes, I work in the NGO sector as a program manager implementing immunization, supporting health facilities, and organizing community outreaches.
Yeah, okay. I'm just going to ask, Reda, can you put up the questions or just paste them also on the chat? So, Maureen, can you tell us how many years have you worked in immunization?
Thank you so much, Charlotte. Actually, in the immunization space, I'm up to 7 years implementing immunization programs.
And where you work, how many health professionals are women and how many are men? And what does working with each gender mean to you?
Thank you so much. Actually, in the program, we have a mixture of gender. Like we have 5 women and 4 men, so a total of 9 working in the program.
And what has been the best part of your work as a woman who delivers vaccine? And I already know from you already said you are a leader in your position. So what has been the best part for you as a woman?
Thank you so much. Actually, the best part for me as a woman in leadership, it has been seeing lives being changed at the community level, like people in the geographical areas which cannot be reached, being able to access vaccination. To me, actually, that's a motivation, which makes me to know that we have kids who are having lives because of the immunization being provided at the community level. Because most parts of the country of Kenya, they are unreachable. We have vast areas where actually accessing them it is a bit difficult. But as a program, we usually make sure that we organize targeted immunization outreaches in those areas, and we've seen influx of numbers. So to me, actually, that is usually a motivation to continue working in the immunization space.
And if there was something you had to change to have a better work experience, what would that be? That's my last question for you.
Thank you so much. Actually, if we could something to change, okay, like in Kenya, if we could reduce the number of unreached children to 0, that one, it will make me happy. It will make me happy because we want to curb cases of unimmunized children from dying and contracting diseases which hinder them actually socially, politically, and economically in their future. So if we prevent it right now when they are still children, it will make a better difference in their lives and at the global at large.
Thank you so much, Maureen.
Thank you, Charlotte.
We have a lot of messages coming in. We have a lot of messages and a lot of music coming in as well. Let's see. I've showed some of the messages. Thank you for this first very moving testimonial. Pervez Yousaf from Pakistan says, according to him, this is the best movement for immunization. You have started and we are with you. I would turn that back to you, dear Pervez, and so many others who are here. Fousseini Dembele, pour les francophones, c'est déjà terminé. And then Zakari Sani, tell us more. What do you think of this group of women who deliver vaccines who are speaking today? And I see many more joining the room. Back to you, Charlotte, to guide us to the next speaker. And please do introduce yourself. Yeah, go ahead, Charlotte.
Thank you, Reda. I want to turn towards Peace Chidima Ilo. Peace, I don't know if you're able to unmute. Go ahead and do so. I'm asking you to unmute yourself. And once you do so, you have the floor. Okay, so Peace, your mic is already unmuted. Please start by introducing yourself and tell us how long you have worked in immunization.
Okay, good morning, good afternoon, good evening. My name is Ilo Peace Chidima from Enugu State, Nigeria. I've been about 5 years in immunization section.
Okay, so where you work, where are you working precisely, and how many of the professionals you work with are women, how many are men?
Okay, I work with WHO Enugu State, Nigeria as a local government facilitator in one of the local governments, and we have a lot of, the gender is almost equal, but we have more men than women working with us.
And what does it mean working with each of these gender? How is the experience like?
Yeah, it's a good experience anyway. But I wish that more women will also be part of the process. We have more women, we have more men than women, and I wish that we have more women in the system. But
okay, so what has been the best part of your work as a woman who delivers vaccine?
Yeah, the best part has been ability to see other women that are disenfranchised in the community, okay, and encouraging them from the female perspective, okay, sensitizing them and letting them understand the reason for this vaccination and the need to vaccinate their children and the outcome of being fully immunized.
Okay, if there was something you had to do to change, to have a better work experience as a woman, what would that be?
And that would be including more, sensitizing more men, especially at the local government area, sensitizing more men and including them in most of the things we are doing at the moment when it has to do with vaccination. Then encouraging more women to join this movement.
Yeah, so why do you want more women to join the movement? Why do you wish?
Yeah, because when we have more women, it gives security to the women in the facility at the facility level, and then it also helps them to understand that it's not a man's world, because from this sector of the world, sometimes we see it as a man's world. So, but most women, when they see more women, they will be encouraged. There will be more sensitization. They will open up more, and then also women will also be liberated from most of these gender norms that makes women to get into hiding and stuff.
Thank you very much, Peace, for sharing your experience as a woman who delivers vaccines with us.
Thank you.
So this message from Ayuba Balas struck me. Obviously, I'm sharing it on screen. Double click where you see the scholar team name to see it. Ayuba says, women who deliver vaccines are heroines. And we also have some thanks for the first testimonial from Maureen. Wonderful. And
thank you so much, Reda. And Reda, there are some comments here in the Zoom studio in the chat that I want to highlight. First comment from Wailing that says, great, promoting gender equity in immunization activities is crucial for the development of the immunization status. And Boma Otobo from MPH-CDA Abuja, working as Deputy Program Manager for NERIC in Nigeria, says women to men ratio in my organization is about 40 to 60. Women will carry other women better as they are the direct caregivers. Thank you so much, and thanks to all those who are leaving their comments in the chat. So, Reda, I think we are going to. Yes,
we have more messages coming in, Charlotte. Before we go to the next testimonial, I just want to see what's coming. I actually haven't looked at these yet. So Joseph Ngugi, who just says, great presentation from Kenya. That was for Maureen's presentation. Dr. Mansour, who just writes his name. Tell us who you are, what you think of women, and what you have to say in solidarity of women who deliver vaccines. More great representation from Kenya. All right, so participants are just catching up. Sean Awokulude says, very wonderful presentation. Women who deliver vaccines are very important and play a very important role in immunization uptake. All right, Burema explains it's over for the Francophones. Keep the fire burning, says Eunice Tangwam. And Marta Ngo says, hello women, keep moving. Joseph.
So great.
All right, there's more. There's a lot of messages, yeah. Charlotte. We're going to stop here, okay? So you can get back. Let's go. Let's keep pushing forward with the event. Go ahead.
I feel like reading some of the messages here, but we have to listen to testimonials. And I always want to turn towards Maria Fernanda Monzon, that is our representative from Argentina, that's Latin America. I want her to share with us her experience as a woman who delivers vaccines. Welcome, Maria. Please go ahead and introduce yourself.
Hello, everybody. Thank you very much. My name is Maria Fernanda Monzon. I am from Argentina. I'm from Corrientes, a small city in the north. I work at the local level. I'm a pediatrician, and I run a health center. I'm the director of a small health facility. I'm very involved in immunizations, of course, and I'm very proud to be part of this group where we are all fighting to have women more in the spotlight, because yes, of course, we are important, very important factors in immunization.
Maria, I just wanted to ask you, how long have you worked in immunization?
Well, for around 5 years now. I've done some international campaigns, and now I'm working back in my hometown. I've worked in Haiti for some time, and I've worked in Guatemala too. But now I'm back here in my hometown.
I'm sure you have worked with several men and women. How has been your experience working with both genders?
Well, I obviously with men are here and everywhere, always in I feel like in a better position than women. We have an opinion, and we have to emphasize it and give more details to be taken into account, and men maybe just go along with it and there's no problem. That's my general experience in every country that I've worked. Like, I have to prove myself even more because I'm a woman.
And what has been the best part of your work as a woman who delivers vaccines?
Well, the best part for sure is working with other people that share the same vocation, the same need to, and the knowledge that you have to reach every kid in every single corner. And I think that's what just at the end of the day fills your heart with joy, when you know that you've done a good job and that there's a lot of people working hard, even if they're not noticed.
Okay, thanks, Maria. And if there was something you had to change to have a better work experience, what would that be?
I would give more power to women. I think that's the thing that I could do. Bring more women to the table where the decisions are being made. I would bring them all.
Why do you think that is important?
Well, because women are as capable and sometimes more capable than men, that we are also fighting frontlines workers everywhere, and that our voices are sometimes not heard just because of our gender. So it's important for all of us to have same opportunities and to have everybody hear us out.
Thank you very much, Maria. And I think we need to, some hand clap for Maria and all those who are leaving their comments in the chat in response to that.
We have a ton of messages coming in, really striking a chord here. Cynthia Adiasani, now this is interesting. She says from Ghana, she works in a hospital in an urban area where reaching the population is not so much of a problem. Men and women are encouraged to come for immunization for both babies, children, and adults. Outreach programs are effective as well. Perhaps an important message there. Cynthia, be interested in hearing what is your specific experience as a woman. How do you feel about as a woman who is involved in vaccine delivery? Joseph Ngugi says to Peace, our previous presenter, a testimonial, nice presentation. Suhini Sanyal says, women play an incredible and important part in every aspect of a society. When it comes to immunization, it's women building a better world by providing better health to millions. It's a privilege to be a part of this, and definitely I'm always in awe of the women around the globe overcoming so many challenges to continue immunization programs every day. Back to you, Charlotte.
Thank you so much, Reda. And there are so many comments that are still coming in the chat.
Yes.
In the Zoom studio. Just keep your comments coming, and then we'll see if we can turn towards them. And I also see there is a woman here, Maria Musa. Her hand is raised. I just want to turn towards her, and other women who deliver vaccines that are in the room. If you want to take the floor, go ahead. Don't hesitate to raise your hand. I'll be delighted to turn towards you. So Maria Musa, I don't know if you're able to unmute yourself. If not, I'm going to turn towards another woman in the room. I'm going to invite Monica and Tini. Monica, Tini, are you able to unmute yourself? If yes, please go ahead and do so. Okay, but I see Miriam Musa is already unmuted.
Hello, everyone.
Hello, Monica, please go ahead. Please tell us who you are, where you're joining from, and what you do.
All right, I'm Monica Ntini, a District of Promotion Officer from Zimbabwe. I now have 2 years experience in immunization programs.
Okay, so 2 years experience. So where you work, how many women are there? How many men are you working with?
Okay, most of the population are women. I can say it's 80% to 20% ratio, women being 80%.
And what has been your experience like working both with men and women?
Okay, I've seen that women, hello, can you hear
Yes,
me?
we can hear you loud and clear.
All right, okay. I've seen that women have a great impact on the effectiveness of the immunization program. However, it has made men now being reluctant on these immunization programs, leaving it for the women, making it difficult for those places where there are few women to provide the services or come for the services.
Okay.
And this is becoming a barrier.
And are there women in your leadership team?
Yes, there are few of them though.
Okay. And what has been the best part of your work as a woman who delivers vaccines?
Okay, the best part is mobilizing people to come for vaccination, and also demystifying the myths on vaccine in all the local languages understood by the community. It has become the best part of my work, whereby people come after mobilization has been done, and also they can be able to understand the need for these vaccines.
Okay, thanks. And if there was one thing you had to change to have a better work experience, what will that be?
Okay, that is making or working in this immunization program to have it a 50% ratio, whereby we say men to have
hello, Monica.
Oh, okay. To involve more men in these immunization programs.
Okay, so why do you think it's important to involve more men in the immunization program?
Oh, all right. I've seen that though women have great impact on the effectiveness of this program, women are vulnerable to violence and also bullying, leading them, some of them missing the schedules for leading children missing their vaccination schedules. And that's why I would rather prefer that more men also should be involved in this immunization program.
Thank you so much, Monica, for joining us today. I think we are going to put our hands together virtually for her, as well as all those other women in the vaccine. Over to you, Reda.
All right, Charlotte, we have lots going on again. Way too many comments to share. Let me just show a few. Majority of women spend more time with children, hence confidence, trust is achieved. That is Dr. Kennedy Muna's comment. June Ojuku says male involvement in child vaccination is important to show both responsibilities in child vaccination. We have more folks introducing themselves. A lot of supportive comments to the speakers sharing their testimonials. Ukasha Musa Hashim, nice talk, Maria. In addition, I think involving women will be better because mostly women care for children, and when women talk to them, it will have more impact. That is Ukasha Musa Hashim's opinion. Pervez Yousaf shares we're working hard an increasing number of the female frontline workers in Pakistan. However, we have some women working at key positions in the EPI but need more. And Cynthia, whom we heard from previously, well, women are respected in the delivery of vaccines. Women form a large part of the provision of vaccination. It may be a 4 to 10 ratio of women to men for her. Now, the collective of women we have heard, whom we will hear from, as well as other women who are joining this event for the first time, has put together the following statement. Charlotte, could you read this for us? Who are these women who deliver vaccines? What do you and the 143 women who created this collective of women mean by that?
We work in health facilities, districts, regions, and in the national team. We are nurses, doctors, community health workers. Some of us are senior decision makers, others do the daily work of vaccination that makes the difference between children, families, and communities being protected from diseases. Wherever we work, whatever our rank or status, we are women who deliver vaccines.
All right, as we progress, we're now almost at the halfway mark, Charlotte, and we know that we have invited members of the Movement for Immunization Agenda 2030 who shared a story of how they were confronted with a barrier that prevented women, men, girls, boys from accessing immunization services in the same way. That's what we mean by gender barriers to immunization. I believe we have a number. Let me see, first of all, pull up the questions. And there's quite an extensive list of questions, Charlotte. And I'd like to ask if you have a gender barrier story and are keen on sharing it, please do raise your hand. Charlotte, over to you. Who shall be our first speaker testimonial for this second segment on gender barriers? We've heard about the experiences of women. And for those of you, because there's so many hands raised and so many comments, for those of you who have not gotten to share yet, at the end of this plenary, we'll be inviting you to a special room in Hopin that we've set up for women who deliver vaccines, and you'll be able to keep sharing testimonials. We have 2 other ways for you to continue sharing your experience, because we know this event is limited in time and we want everyone to be able to have a voice. Over to you, Charlotte.
Thank you so much, Reda. So like Reda just said, if you have a gender-related story you want to share in immunization, go ahead. But for my first guest today is Yewande Ogunkwade Christiana. Your mic is already unmuted. Please go ahead and tell us who you are and where you're joining from, and then share your story with us.
Hello, can you hear me?
Yes, loud and clear.
Okay, my name is Yewande Ogunkwade and I'm a nurse. I currently work at the United Nations Isolation Center in Nigeria, and I also double as the medical administrator for the COVID-19 vaccination for United Nations staffs in Abuja, which is the capital city of Nigeria. Okay, so I'll just be sharing a little story on gender barrier to immunization that I encountered during my experience working as a nurse. So sometime in 2020, there was a set of twins whom have been coming to take their immunization in the clinic. And of course, they take these immunizations together as twins. They always do take every immunization or vaccine together. And then these twins one was a male and the other was female. But when they were about 10 years old, they came to the clinic for a vaccine, for an immunization, and then it was apparently the Severix vaccine. So you all will agree with me that Severix vaccine is gender specific. Of course, there are other HPV vaccines that could be taken by males, but for Severix, it's only taken by females. And so, of course, I had to vaccinate only the female child. And her brother wasn't taking it lightly. He wanted to also get vaccinated. So I needed to do a lot of counseling, health educations on the anatomy, reproductive system, and the reason why this vaccine would only be taken by his sister and not him. So I saw that this barrier was gender specific because they were not informed, and because they've always been taking their immunizations together, and this vaccine was gender specific. I just needed to counsel, health educate, not only them, even their parents, in case of further vaccines and immunizations that are gender related. Hi, Charlotte.
Okay, thank you so much for sharing your story with us. I think, and if you have a story, gender-related story to share about gender barriers in immunization, do not hesitate to raise your hand. But before that, Reda, I think I'm just going to go on to our next so that we can get to listen to as many stories as possible. So I'll go on to our next speaker. I want to invite Martina Karimu. Martina Karimu, if you're able to unmute yourself, please go ahead.
Hello.
Hi.
My name is Martina Karimu. I'm speaking from Ghana. Actually, I'm a nurse at the curative aspect of health, but then I went to school. I went to do public health at Legon, and whilst I was there, I had the opportunity to be in a class with some of our nurses who work in the communities. And one of the stories from the Volta region, that is one of the regions in Ghana, was about the trocosi system, where women are made to serve the gods of certain areas in the Volta region as a result of maybe a sin a relative has done. So in this case, the women are sent to the shrine, where the priest is mainly the head and actually takes these women as wives. So in the event where the women get pregnant and even in pregnancy and after giving birth, the children are not vaccinated. And even in the pregnancy, the women do not gain any sort of health service, because before you be able to gain access to the women, the priest might require you to perform certain rituals, which even though you're a health worker, sometimes it doesn't really sit well with most of us. And then there are situations whereby the woman would also have to sneak out of the community, because it's like a shrine, but then it's a whole community on its own, even in the midst of a large area. So usually some of them are able to sneak themselves out in order to get the vaccination, or you either stay in the community and your child does not get vaccinated. So in this case, where the women are restricted in making their own decisions, it makes immunization in that kind of area very difficult. And that is what I have to share. It's been going on for a long while, and there seems to be no kind of solution to it, since it's, apart from it being a gender-based issue, it's also more of a religious issue, and people in Ghana actually take religion quite seriously. So it's kind of a problem when it comes to having like going on immunization campaigns and all that. That is something I have to share with you all. Thank you.
Thank you so much, Martina Karimu, for sharing this story with us. Red, I think I'll take a pause here if there are any comments from our
there are lots of
media
comments, believe me.
platform.
Yeah.
Any helping?
There is, yeah. All right. Charlotte, yeah. While you regroup for our next speaker, and just let me clarify, these speakers are sharing their testimonial. Each one is expressing their personal opinion. Now, I do want to share important information. It's obvious. There are many of you who are here in the room who we are going to run out of time before you can share your testimonial. We believe your story is important, it matters, and so we've planned that we figured out 3 ways in which you can continue discussion after this plenary. So first of all, you can go, of course, to the networking in Hopin. And here, you can see there's many people networking right now. So you go to Hopin, you have a discussion guide that we've shared with you to help you, but you may not need it. Just talk about what matters to you, what challenges you're facing, what solutions you found in the process. So that is option 1. Second option is to discuss with a small group of colleagues. So if you now go to the sessions here, if you're in Hopin, leave networking, go to sessions, and you will see right at the top is this space for women who deliver vaccines. And in fact, there's already 6 people there. And this is a space for group discussion. It is not moderated. So you can just join and you will see, let's go see here, there are already people who have joined and are in fact discussing the women who deliver vaccines topic. And last but not least, this one is maybe technically a little bit more, may seem complicated. If you're in the Teach to Reach Telegram group, just hit the little microphone icon and record your testimonial. Share your story if you don't get to share it today. And that will then enable everyone who is attending Teach to Reach to listen to it and to share back their thoughts on it. So I think that's it, Charlotte. From me, back to you for our next speaker.
Thank you so much, Reda. Earlier on, I had invited Udzau Yusuf to speak. She wasn't able to unmute, but now I see that she's unmuted. So Udzau Yusuf, please, can you go ahead and introduce yourself? Tell us who you are, where you work, what you do, and share your story with us.
Good evening, all. I'm Udzau Yusuf. I'm a pharmacist. I presently work in University of Maiduguri Teaching Hospital, but during my residency training in public health pharmacy, I actually met so many women in the primary health care that came for immunization for their children, but then they told us about many other women that were not allowed to come by their spouses. The men feel there is no need for immunization, there is no need for antenatal. Once you come for maybe antenatal or immunization, it's a pathway, it's like a gateway that you come for other healthcare services. But these women are forbidden from attending antenatal services or going for immunization. So these children are just there, and when they have these vaccine-preventable illnesses, they are given maybe concoctions, or they say it's spiritual or something else. So that's really a challenge here in Borno State, Maiduguri, where there's high level of illiteracy and lack of awareness. So that's really
in that situation, what did you do to get to encourage those women to join, or to get their spouses to allow them to come for antenatal care and immunization services?
Okay. Actually, I think that one is more, in my own case, we actually had a meeting. So each time they come, we encourage them to talk to us, ask questions, but then to also meet their colleagues. If the men, if they feel there are women, their wives are going to meet other women there at the center, I think they are more comfortable, but at times they don't even allow them at all. So if they can go to those houses, and then if some of us mobilize in such a way that
Rather, it seems as
You
if we
visit, you just enter. If you enter the house, you can really talk to them. But then it's even goes beyond us. It goes to the youth, the ward heads, the religious leaders, so that form of advocacy, so that the people are enlightened. The youth, the men feel they now know the importance of maybe allowing their women, why they should allow their wives or sisters or their relatives to really come for those. So it really calls for constant education, encouragement, and advocacy. We have started in our own little way, but then although it's going a long way, but we really have to keep on doing that.
Thank you very much, Udao Yusuf, for sharing this testimonial with us. I think I'm just going to connect directly with Shah Faisal. Shah Faisal, if you can unmute yourself to introduce yourself and share your story, answer the questions that we set for you. Over to you. Please, can you tell us who you are, where you're joining from, and what you do?
Thank you very much. I'm Shah Faisal. I'm working from last 15 years in different part of the countries. And here I have worked about 3 years in Nigeria, one of the state known as Katsina, immunization programs. And definitely what you said that was very important. The gender is very important, and there was a lot of biasness, gender discriminations and gender disparities in immunization programs. When we talk about, then I have been giving example to the polio immunization, routine immunizations, and even the COVID. Now we are working on the COVID. There's a lot of stigma, there's a lot of misconceptions, as much informations in the community also. So I am giving the experience by working within India and Nigeria also, that a lot of confusion regarding that importances and regarding that vaccination efficacies of have been developed also. So when doing immunization activities at various levels in the communities, people are just talking about that one. So sometimes they give the vaccinations to only to the female children, not to the male children. Avoid the misconceptions regarding the importances. So they usually given the vaccinations to the female children, not given to the male children, because of they think that in a larger and later life of their when they grown up, their child, there is important in the female also, and male and children also. So and there is a lot of religious, social and cultural stigma related to the these vaccinations. We have done a lot of mobilization. We have done a lot of communications activities, even at various level, from the WHO, from the UNICEF. A lot of development partners has done a lot of efforts regarding the risk communications. But media and these type of social medias play vital messages if you talk about the COVID vaccinations. Because of a lot of currently we are facing a lot of buzz in giving information, because a lot of hesitancy taking the COVID vaccination also. People saying that after 2 years people will die after these vaccinations. So they will give the vaccinations to female, not giving to the male children also. So this is the gender disparity and gender biasness among the community also.
Okay, thank you very much for sharing this, Shah Faisal. We are going to take a pause maybe to take a look at the comments that we have on our various platforms.
Thanks, Charlotte. And also, I understand that this is a collective of women who deliver vaccines, but you have called for the solidarity of men to speak out in favor of overcoming these gender barriers. Let's go now see what's happening. So again, too many messages to share them all. We'll be sharing in the follow-up, of course, Promise Onaibe, who says women are very important in the field of immunization. They are more in the grassroots, they're more in community social activities, and they're close to the children because they made up 100% of caregivers. So let's see what else. Jamila Mobi, in this case, you need to organize compound meeting with the mothers. So that's a response to one of the presentations. Rosemary Onibe says, glad to be in this great event. We need to begin to think of using mothers and grandmothers as powerful sensitization agents to educate and sensitize the males in areas where women need to seek the husband's consent for immunization. And then women need to be encouraged to take child vaccination to the next level. I'm going to stop here, Charlotte. Back to you for our next presentation.
Reda, I am going to invite Loretta Akupeme, whose hand has been raised for a while now. Loretta, okay, your mic is already unmuted. Please go ahead.
Good morning, good evening, everybody. My name is Loretta, and I work in Nigeria as an NGO personnel. I visit a lot of primary health cares, and in the process of visiting them, most of the people I meet or workers I meet in primary health centers are women, and they are actually the people that delivers the vaccines to the community people. And what I have also noticed is that a lot of them are trusted by the community people because they are always communicating and coming with their challenges. And in the process of visiting those primary health centers, I've also been able to interact with a lot of the women, either the pregnant women or the ones that are coming with their children, for immunization. And in that process, we have shared a lot of experiences. They have, told their problems. They have shared their problems. Mostly, they are afraid of the side effects of some of the vaccines. Like the ones they said that their children took vaccines and they had side effects. Some of them had to go with, boils and all that.
Loretta, please forgive me for interrupting you, but I just wanted to ask specifically in terms of gender-related barrier. What's the personal story that you have had to encounter while you go on the field to interact with healthcare providers?
The only challenge I have noticed mostly is that some women forget the vaccination sessions. So we're trying to encourage the men, their husbands, to support them by at least helping them to remember, maybe remind them, and as well support them to go to the health centers. If you can't at least stay with them at the health centers, you can at least take them to the health centers for those of them that have cars, and for those who does not have, give them transport fares, assuming they can't walk to that place. Maybe some of the health centers are not very close. They need to take transport to go to that place. So we encourage the men to assist the women by providing transportations to them. And if they can, go with them to the primary health centers to support them, to know so that they will understand that the process of immunization is important for the children. For the gender segregation as to vaccination, I haven't actually witnessed that, but I have heard stories about that, but I haven't actually witnessed that myself. So I cannot actually speak on that. But what I want to change is for me in my country, Nigeria, to encourage our government to please support these women that deliver vaccines. Because a lot of them have to leave their homes early in the morning and get back very late in the night. And at the end of the day, some of the months, they go home without their salaries. They go home without the remunerations, and it is not encouraging at all. If we must get a healthy community, then we must support our health workers to deliver their jobs very well. Thank you.
Thank you so much, Loretta.
All right, Charlotte. We have...
Yes, still so many raised hands. I think we are celebrating and honoring women today. I want to turn towards other women who've had their hands raised for quite a while now. So I'm going to invite Roseline Trokpao Chesson. Roseline Are you able to unmute? Yes, you are unmuted. Please go ahead and introduce yourself. And remember, we want you to share a personal story recently where a situation where you experienced gender-related barrier to immunization where you work. Roslyn, over to you.
Yeah. Thank you all so much. It's good afternoon from my end, and I really admire the stories of the previous women. So this is an experience I had when I was serving as a consultant with UNICEF for the NOPD round one.
Please, can you start by introducing yourself?
Sorry. So I'm Roslyn Yatro-Pawo-Chesin. I'm from Liberia. I'm a nurse and a public health expert in Liberia. I currently work for an NGO called Americas, but this story I'm about to explain is relative to a consultancy I did with UNICEF in Liberia. So I did a consultancy for the NOPD 2 round 1 vaccine. I served as consultant for vaccine accountability. While we were doing the tracking, following up with the women or the team in the field who were delivering the vaccine, there was this lady. It was so pathetic. They had to walk from one village to the other, far distances, and she was on her time. She got very weak from the sun. We had to give her really help and ask her to sit and work. It's a work that everybody would do, but she wasn't prepared for that period to do that work. So that's my experience with the gender issue and delivering vaccine in the field.
Okay, thank you. If I got your story Roslyn, it's the woman was a healthcare worker, was a vaccinator, if I got you right?
Yes.
Okay, and she had to walk long distances. That is normally a work that could have been done by a man easily.
Yeah. And then besides that, she was on her period, so she became dehydrated, she became weak. So for that time, she wasn't fit for the field.
Okay, thank you so much for the story. And I'm going to go right away. I'm turning right away to Christine Bolanle. Christine Bolanle, your hand is also raised. Christy, okay, I see you have unmuted yourself already. Christy, please go ahead and unmute. I'm asking you to unmute again. I saw you were unmuted a while ago.
Good afternoon, everybody, or good morning, wherever you are hearing me. I'm Christy Omidiji from Peace Heritage Foundation, Nigeria. I'm CSO Academia, health educator and gender advocate. I always monitor immunization for WHO at my state level. And from the experience, I realized that the impact of gender-related bias is more on women and children. The reason is these women, they don't believe they have power. Financially, they are down. Cultural bias is also there because there are some villages, strongly they don't believe that their children should have immunization. We have some people that we always call them hard to reach. The village may be far from facilities, and if the health workers are not reimbursed, to go to deep down those areas is another challenge. And we are working more on their their husbands to educate, because we create more awareness and sensitization for the men too, so that they'll be able to release their wives and children for the immunization. Presently, we are planning something because there is current project going on in my state in which my organization is also involved, of 0 dose penta vaccine. We realize that these people, we still have some children that have not received any vaccine at all. Some defaulted. So we are now thinking on the strategy that will attract these people to bring their children to the clinic for vaccine. We are now suggesting if we can have a program for them, that there will be a small gift for children vaccinated. Maybe their husband will allow their wives to come to center and do the vaccination for their children. There are a lot of things we need to share the experience with each other so that we'll be able to improve this in every area. And to build the purpose of coming together here, I believe we need to build the capacity of countries to recognize and analyze gender-related bias. It may vary in various countries. What transpires in Nigeria may not in other countries. So we need to work together globally and collaborate with partners, even other stakeholders that are not health-related, but we feel that they can be relevant. We need to work more now and extend our tentacles to others. Thank you.
I want to acknowledge and honor before we close this this plenary session and explain what to do if we're sorry that there. I can't even count the number of hands raised here, but before we go, I'm going to explain to you how you can now go to a session to share your testimonial to make sure that your story is heard and shared with others. Here is the page developed with the collective of women who organized this event. I do want to honor them by showing the list of names of the organizing committee and reading the countries from Argentina, Benin, Burkina Faso, Cameroon, Congo, India, Indonesia, Ivory Coast, Nigeria, the DRC, Egypt, Ethiopia, Gabon, Gambia, Ghana, Madagascar, Lebanon, South Sudan, Tanzania. You can see 38 countries altogether, right down to Zambia. And I'd like to ask you, I'm going to ask you to unmute. And I'm just going to ask everyone to unmute. And please, let's... I'd like to hear a round of applause. Alright, please put your hand, even if you're alone in front of the computer screen. Women who deliver vaccines. We're going to take everyone on your window just for a few seconds. Thank you so much. Now, what happens next? For those of you, if you'd like to if you would like to continue sharing in 2 minutes, first of all, we have an exciting session on the topic of motivation amongst health workers. So if you'd like to participate in that session, you don't have to go anywhere. It's going to happen here. But if you are thirsty for more, if you'd like to keep this discussion going, to continue sharing testimonials, and you are in Hopin, the time is now to go to these sessions. And if you go to sessions, you can see here I'm navigating on the platform, and in the sessions there's a space for women who deliver vaccines. I see there are already 10 scholars who are there who've already started the discussion, so you can share. All right, wonderful. You can see there is already a discussion happening. Okay. You can go to the sessions and continue. And then the other option we have for you is to actually get on the Telegram group. So if you manage to get on the Teach to Reach Telegram group, you can get on the group, and you'll see here that you can simply click on the little microphone at the bottom right of your phone and just record yourself. Introduce yourself. You have the questions. We share them with you by email, and then you can share your story and listen to the stories of others as well. So we share more testimonials about women who deliver vaccines. Once again, thank you for having joined this exceptional event. If you want to attend the motivation session, you don't need to go anywhere. One final round of applause, and thank you, and goodbye. Women Who Deliver Vaccines. As you can imagine, our mistress of ceremonies is one of the founders of this collective, 143 women from 38 countries who came together. And I would suggest perhaps to start with an explanation of who are the members of the collective. Charlotte, over to you.
Thank you very much, and warm welcome once again, everyone, to this special session organized by the Collective of Women Who Deliver Vaccines. 143 women from 38 countries who came together from all levels of the health system, who are involved in every stage of immunization service delivery, to share their challenges, to see how they can support one another, to ensure that those who need vaccines get them. So we are women from all levels. Many of them are here in the room, and you'll get to hear from them in a very short while. But remember, during Teach to Reach Connect 5 on the 4th of March 2022, we had an event to honor women who deliver vaccines in celebration of the International Women's Day. And afterwards, today we want to find out, since hearing from experiences on what people are doing to handle gender barriers to immunization, what have you been doing? And I'm glad to announce that so many men responded to our call, and they are doing so many things. So today we'll also get to hear from them. And I also want to recognize that before today's session, this one is actually the third event in a series of 3 that we organized with the Zero Dose Community of Practice around that works around strategic priority 3, that is coverage and equity. So the first 2 webinars were on social and structural barriers to immunization. This one today is purely experience sharing. Thank you, Reda, and over.
Thank you, Charlotte. And so we'll have the session will be split into 2 parts. One is we'll be turning to members of the Women Who Deliver Vaccines Collective. And if you are a woman who works in vaccination, then you can consider yourself a member of the collective as is starting today. If you have not already joined, there's, of course, the group of founders that Charlotte referred to. And we're looking to really your personal story as a woman working in immunization. You can see a number of questions here. I'll be pasting them into the chat in case you're on your phone or if it's difficult for any reason. And then the second half of the session will be looking to men and women. And as Charlotte said, we were impressed by the number of men who work in immunization who responded to express their solidarity, to share the invitation to this event, and to really want to express their willingness to contribute and help work hand in hand with women who deliver vaccines to make a difference. So Charlotte, let's start. Let's dive in. Who will be the first woman who delivers vaccines to share her story as a woman working in immunization?
Thank you very much, Reda. So I'm calling on the women who are in the room right now. If you are able to unmute yourself to respond to the questions on the screen in terms of what you have been doing as a woman who delivers vaccines. And just to say that I myself, I would like to speak a little bit because I am part of the collective of women who deliver vaccine. And I may not answer the questions directly as they are on the screen, but what I'd like to say is since the 4th of March, we have been getting more and more talk about around how women can get involved in immunization, how their place is indispensable if we are going to succeed and achieve immunization goals, especially when it comes to reaching the goals of IA 2030. And facing professional challenges as a woman, of course, yes, in my days of working in the immunization program in my country, I regularly attended meetings where I was the only woman, and we actually started a kind of talk in which we were saying, okay, we want to put forward promotion of gender equity and gender equality when people are convened for workshops and meetings. there should be some factors that ensure that at least 30 to 40% should be women and 60% the men. But I'm glad that more and more we are getting more women involved, not only on the front line, that is as vaccinators, as community health workers, but also at the level of decision making. But our cry as women who deliver vaccine is that we should get more voices, even women participating in our events, like is the case today. So right now, I'm going to turn towards.
And Charlotte, that's true. In a way, as mistress of ceremonies, in a way, it's unfair that you do not usually share your personal story. So I'm glad, or yes, I respond to the questions yourself. So I'm glad that you did here, as you are first and foremost an immunization professional. So we have the first woman who delivers vaccines, Sifiwe, who is who has unmuted. I'm going to put the questions back on screen. So Sifiwe, a warm welcome to you. Can you briefly introduce yourself, and then we'll go through the questions together.
Hello, how are you?
All right, wonderful, and wonderful to hear your voice. So you can see here, are you able to see the questions on your screen, and are you ready to? Yes. Okay, over to you then. The floor is yours.
All right, my name is Sipira Murepa. I'm from Zimbabwe. I work as a health promotion officer in Umzingwane district. But since the special event on the 4th of March, I was at the provincial office, so I was working actually covering the whole province of Matabele South. So during that time, actually, we had I had shared my challenge, or shared the situation that was there in one of the districts in my province. Actually, the issues that we're having is that we're having women that really wanted to get their children vaccinated, but because of the religion that they're into, the men or the leaders of the church did not allow them to get their children vaccinated. So actually, the breakthrough that we had is, after we had done a lot of advocacy meetings with the church leadership, they would put an excuse that it's the women that we're not coming for. Yet they will not allow us actually to get to have an audience with the women. So later we decided, we opened a new clinic around the village that most of the objectors actually stay. And when the clinic opened, they actually enrolled some of the women to work at the clinic. And those actually became our advocate for us, because they knew they were from the same religion. So when they went back to their community and they started to relate how health services were good for them and everything, women started to come to the health facility, though nicodemously, because they are not allowed in their religion to get their children vaccinated. So, but we have had a breakthrough of women coming through strategies to get their children vaccinated, and even them accessing healthcare such as family planning services. So it has really been a breakthrough for us. Yes, we are still advocating with the church leaders, but we know secretly that there are other women that are already accessing healthcare, and that part is important for us. And looking at the current, we're facing a new an outbreak, measles outbreak, and as Mat South, we're actually worried with, even though the outbreak is still very far from us in Manicaland, in the eastern highlands of Zimbabwe, but we are also preparing with giving them information how they can actually get their children vaccinated to prevent the measles reaching to their children. So it really has been a great experience when you see women that are now sort of empowered to actually go and look for services for themselves. So I would encourage other women in the immunization that, when you do a one-on-one dialogues with these women, you actually realize they really want those services, but there are other barriers, maybe that can be social, that may be hindering them from coming for services. But when you really talk to them, you actually find out that they're really in need of these services. So we continue dialoguing with the church leaders, but it's really been slow in that area, but we'll still continue so that at the end of the day, they don't come secretly. We hope we'll have that breakthrough soon. Yeah, thank you. I don't know if I answered most of the questions.
Thank you very much indeed, Sifiwe. Wonderful to hear your story. Now, with us in the room are those we call the guides on the side. And there are partners from the Zero Dose community of practice, as well as gender specialists from different international partners. We're going to introduce them in a little bit. They are Shubo Rashid Jalal Ruzbani, and I believe at least one other person supposed to join, but we'll go to Shubo after hearing several of the stories that are being shared, first by women who deliver vaccines, and then by women and men who are interested, who will share stories of overcoming gender barriers. Back to our mistress of ceremonies.
Thank you, Reda. I'd like to invite Boma Otobo. Boma, your hand is raised. You're one of the founding members of the Women Who Deliver Vaccines Collective. Over to you.
Hello, everyone, and thanks, Charlotte and Reda, for this wonderful opportunity, if I may call it so. My name is Boma Otobo, and I worked with the National Primary Healthcare Development Agency in Abuja at the national level, where we are strategically in charge of immunization. Looking at women who deliver vaccines, I will count myself lucky because I never thought this opportunity would come. But the way I have found it, I have taken the bull by the horns, and I'm sure other women like me are also making great strides to ensure that at the end of the day we get what we want. Yeah. So taking a look at the topic today, what has changed for me since March the 4th? Yes, I would say quite a lot. The experience of being with the Geneva Learning Foundation is something I cherish so much. And we all know the goals of the IA 2030, which is a vision of a world where everyone at every age fully benefits from vaccination for good health and well-being. So even looking at that goal, I take it as something personal to me. Vaccines are they are life-saving, and they are very effective, and they are not as costly as treating the disease, so to say. So when you look at this vision, it gives me a push, and I'm so glad that I'm aligned with what the Geneva Learning Foundation is doing. Now, the second question is talking about the role of women in leading the 2013 IA movement towards its goals. Yes, we have seen the goal. And for me as a woman, I see myself as a goal-getter. I know that once you set a goal before me as a woman, just like I do even at the home front, I will not stop working until that goal is achieved. So you can see that women play a very vital role. Women are the caregivers, the primary caregivers. So for us to make up our minds that we want our children and others to benefit from immunization, then that's something good and great for the community as well. So women are leading, and women are definitely making their voices heard wherever they are. What can men do? Of course, men can encourage, in as much as also showing the way to go. So they can encourage, they can stand by us as women to ensure that whatever goals are set, we all achieve as one, so to say. Have you also had any professional challenges as a woman? I will say several. I have had several challenges. One that touches me most is when men or other people consider me as a weak link, so to say. And so you find that when we get to carry out a program and I'm deliberately sidelined because of my gender, I then take it on me that I need to prove myself that being a woman is not a curse. Instead, it is a plus. Because at the end of the day, I find even the men folks coming to tell me that I have done very well in keeping everybody together. It's like when you put cement in on the floor and you leave it and go and come back, it becomes hardened. That is the role of a woman in a team. The woman ensures that everyone achieves. So as much as possible, I have also tried to gain knowledge, because that's one thing that I would not want anyone to fault me about, telling me because I'm a woman, I do not know what I'm doing. No, I would rather want to teach them and train them, because I have gone ahead to learn and to make sure that I actually am getting more from what I'm being taught. Now, what will be my message to women? I want to encourage every one of us. We are not here by accident. I'm talking about the Geneva Learning Foundation. We have come here specifically to learn how women can lead. I like when men lead, but I like it better when women lead, because at the end of the day, the woman will not give up until she achieves success. So I want to wish everyone who is a woman here today, please take the bull by the horns wherever you are. Ensure that success is gotten. I want to say this again. I like working with the traditional institutions. Wherever I go, I try to identify who these gatekeepers are, and I make my presence known to them. And I ensure that at the end of the day, if I have issues, challenges, I always run to them. And once they speak, everybody goes in, to do what they've asked that we should do. So I like to leave it at this point and to wish everyone here success in what we do. Over. Thank you.
Inspiring and motivating experience that has been shared. Reda, we'll listen to one more before we turn to the guides on the side, because I have Lucy Kanja that has been waiting for quite a while.
Yeah, greetings from Kenya. I'm Lucy Kanja, vaccines and immunization consultant, working with UNICEF and currently supporting Ministry of Health National Vaccines and Immunization Program. I've been a member of Geneva Learning Foundation for quite a while, and every time I join in, I learn new information, and therefore a great platform for us to learn. Now, on the questions of the day, what has changed since I joined the special event on March, and what am I doing differently? Number one, after learning on the global strategy on leaving no one behind, it was like an eye-opener to me, because now you realize we are not having the only infancy vaccination services. We also have now the adult, and even with COVID-19, new challenges have come on board, and therefore now I look at immunization program differently. Then question number two, what is the role of women in leading Immunization Agenda 2030 toward its goal? Looking at the strength of women and their concern for the families, to me is a force to reckon with, and particularly when I look at the priority framework of action of IO 2030, Immunization Agenda 2030, I'm in love with priority number one about primary health care and universal coverage. Also number three on coverage and equity and outbreaks and emergencies. And why did I choose those three? And also I'm in supply chain and sustainability. When you look at especially when there is outbreak and emergencies, the women and children are the most vulnerable populations that are affected whenever there are those challenges. And when we have voices of women coming in to support the programs, make sure that their voice is heard. Then on question number two, who are the individuals involved? What gender are they identify with? Number one, when we involve women in health strengthening, you look at all the components of health system strengthening, from leadership and governance, health financing, healthcare workforce, health infrastructure and service delivery, health commodities and vaccines, health information system. When we have those voices in all those components, you find we are able to achieve more, and because we are able also to reach to the last mile. Then what is the role? What is the role or your responsibility in this situation? I was remembering one community that we visited, and we went to give vaccination because we realized they had so many cases of 0 doses, and therefore we felt that most children were missed out. And when we visited that community, we realized that the women were not allowed to give consent for vaccination, and we had to wait up to the weekend when the men are in the community so that they can give permission for those vaccination to continue. And I learned from the engagement that we had with the community, and they allowed the teams to be going there. There was an opening of having door-to-door every second week of the month. And for me, that was a game changer, that somebody was able to put a face on the importance of vaccination, even to a community that had it was a group of people that had refused vaccination. And what are the barriers that we found? The barrier was like now how it had to take us a lot of time to convince the gatekeepers that they can allow their women also to decide on the vaccination services. And how did it end? It was a win-win because currently the services are ongoing door to door, but over the weekend. So we had to go out of our way instead of the way people were used to just going Monday to Friday. Now they are able to go out of their way and go over the weekend to make sure that no child is left behind. And what was there anything that surprised us? Yes, because that community is in the city, and we did not expect to have such barriers. Even when people are in the city, we expected that to be in the rural area. But we are glad that now they have accepted, and therefore children are vaccinated over.
Thank you very much indeed, Lucy Kanja. The time has come, Charlotte, I believe, to turn to our guides on the side. So we have two that are going to introduce themselves when they speak. So Aftab Kawaja and Shubo Rashid Jalal Ruzbani. We're going to start with Aftab and then Shubo. Please, as we ask of all participants in these very short sessions, please be concise, get to the point, focus on really responding in terms of the support that you are able to provide to in response to what you heard. We'll also, if time allows, we'll turn to Deepa Pokharel, who's kindly offered to also share her feedback and insights. So over to you. Let's start with Aftab.
Thank you so much, colleagues. Good morning, good afternoon. It's Dr. Aftab. I'm working with the immunization team based in UNICEF country of West Islamabad. So coming back to the point, I heard my last two colleagues, Momi and Lucy. And due to connectivity problems, I was not able to join from the start of the session. So I really like these two talks by these colleagues. So as mentioned by Momi, I think the key point was, which I really like, that as a female, we need to follow the results, and we need to be leader at every point, at every point in our life. When women will take the leadership role, they will take us to a kind of success, not only in their professional lives, but in every aspect of our life, whether being a caregiver at home, at workplace, wherever they are. So that's a kind of critical point. I think it's a kind of basic principle which we need to follow, that as a man we need to give this role to the our female colleagues at every point, at every aspect in life. And this leadership role, when it's taken by our female colleagues, that will have a huge impact in each and every aspect of the life. Secondly, I also really like this discussion by Lucy. I mean, the key point she made, I mean, that's a kind of real bottleneck, that the decision-making part is not with female. The decision-making part, it's with male at home, who is not at home, who is not taking the responsibility of caregiver at home to kids. I mean, we also observed it's a kind of, as a common practice, that the decision-making is with male. And whenever our teams, they are visiting to the community, mother or female caregiver at home, they don't have the power to take the decision whether they need to, whether they can have their child vaccinated or not. So the impact is not only on the female child. This lack of having a decision making authority with our female caregivers, it's also impact the male child at home. She's not able to decide whether she need to get their male and female child vaccinated or not. So, which is definitely contributing to our zero dose children and zero dose communities. So, I mean, if I summarize these two things, number one, we need to advocate to give the leadership role to our female caregivers at all levels, and then the decision making. And this will definitely help to improve the immunization coverage, reduce zero dose children and zero dose communities, and help us to achieve the IA Agenda 2030. So I will stop here and handing over back to my colleagues.
Thank you,
Over to
Aftab Kawaja. Over to Shubo Rashid Jalal Ruzbani.
Yeah, good morning, good afternoon, colleagues. I'm really pleased to be with you today. I hope you can hear me.
Loud and clear.
Okay, good. So I really want to thank, I'm the Senior Gender Advisor in UNICEF Headquarters, and I'm really pleased to hear the stories and join this session. Very interesting and very informative indeed. I want to thank Charlotte, Safeway, Lucy, and Boma for sharing their stories and the inspiring messages that they have actually shared with us. I would like to give you what I heard. I heard we can achieve more by giving the voice of the women and girls in the field, listening to them. I heard men can be effective, men can be obstructive, but men can also achieve more if we engage them. I heard female health workers have a great role in the IA 2030 agenda as implementers, as leaders, as actually the agents of success for such agenda. And we heard how we shouldn't actually look into the female health worker as a weak link, but as an empowered link. And I also heard that let's also look into the gatekeepers and see how we can achieve more. So we can achieve more through this. This is what I got from the different stories that we have heard. And I would like to add also to that is, when you have that resistance by the religious leaders, let's learn from each other. There are some success stories in other countries that we can build on. For example, in Egypt, there was this book that came out from the Coptic Church, advancing the rights of children, and of course it was jointly with the Al-Azhar Muslim community, where they are advocating for the rights, including the rights of health. How can we use those as a push factor to those resistant in that particular community that you were referring to, Safeway, in Zimbabwe? So learning from others, sharing the experience, and I think the empowerment that comes from this kind of connection amongst the countries, the women who will deliver vaccine, the professionals in this field, I think this kind of gathering is also an empowerment where you can pose your questions. I have such a problem. How can you help us in doing that? Well, women in leadership, Generally, globally, like 70% of health workforce is female, but not as that significant in leadership position. And this is really important. I want to give you an example. I was in Yemen developing communication materials for cholera outbreak. And all those who are engaged in developing the materials, and the materials speak, dear mother, dear lady, dear sister, all the materials having addressed the need for the woman, but all those who are involved in developing those materials are actually men. And this is a concern. I have raised it with the ministry, and the ministry acknowledged that. How can you design a message targeting women by only doing it from behind the desk? You need to go down, you need to listen to them, you need to know what are their concerns. Like Safeway was saying, no woman does not want health for their babies. They want to vaccinate. Once they understand the value of vaccine, they run to vaccinate their children. But it is the choice and the empowerment. So if we are not able to give that positioning, that empowerment for the women at household level, given all the challenges, the domestic work, the fathers do not allow, the cost of taking the child to vaccination, making them more engaged, give us an opportunity to achieve more. I'll stop here. Thank you.
Thank you, Shubo Rashid Jalal Ruzbani. Charlotte, it sounds to me like you may have a new member of the Women Who Deliver Vaccines Collective. Are you going to invite Shubo to join?
Definitely, Reda. Remember, we say we are women from everywhere, from every level of the health system. And if we need global voices, then Shubo is welcome to join us and to be our global voice.
All right.
My pleasure to join this. I will be humbled to be joining this a great initiative.
Thank you, Shubo. And we do have a third guide on the site. It'd be a loss for our plenary if we did not hear from Deepa Pokharel. Deepa,
Thank you, Reda.
Yes, please. Would love to hear your thoughts, reflections after the three stories, and then your colleagues who've already commented and responded.
Thank you. Thank you so much, Reda. So just on a quick introduction, I think this might be a different audience. My name is Deepa Pokharel, and I'm the Senior Advisor for Social and Behavior Change, but also the team lead for vaccine demand at the global level with UNICEF headquarters. So a lot of these things, what I think the colleagues have commented on the stories, great stories to hear from colleagues, but a couple of things which really sprung to me. One is the empowerment. At what level are we? Are we having women on the table as equal partners when we are developing, whether it's a government level plan or micro plans at the community level? We really need to have equal footing at the table so that real issues come. But we're not saying that gender is just about women. Of course, there has to be an equal voice given to both men and women. The second thing is rather as what can we do to address some of the things that we are seeing in immunization related to gender. There are many practical issues, timing not being very convenient for women. Are we doing something extra to reach to the women, elderly women in the COVID, for example? There have been many experiences of people feeling not comfortable coming for the girls not wanting the HPV vaccine to TT vaccine. So these are just real issues, and the strategies when we develop, as Shubo was saying, how can we develop something without engaging the girls and women themselves? That's very important. But I would also like to say that men have to be engaged, not just as supporting, as decision makers, but also to make sure they are taking care of the children's need in the immunization. It's not just the women's role to get the children vaccinated. It's equally the responsibility of the father, the grandfather. So I think we'll have to look at it in a different way of the women at different levels, all kinds of women that we've heard from, at different levels, from community health workers. We all know that majority of the community health workers are really female, and how do we empower them so they are equipped with not just information but also the peer-to-peer support, the things that they may need in terms of having a proper HR in place. How do you advocate that there needs to be more female in the system? I think we'll have to look at it very holistically, and all these stories from the women are very empowering, starting with our own very Charlotte. So thank you so much.
Thank you very much, Deepa. All right, back to our Mistress of Ceremonies. So this time we're going to go to the second half of this plenary. Think of a recent experience when you encountered a gender-related barrier or concern when providing immunization services in your work, and you were able to do something about it. So you're going to tell us again, get very specific, not generalities or your opinion about these issues, but something that actually happened that you were directly involved in. We want to hear your story. Over to you, Charlotte, to tell us who will be our first speaker for this segment.
Thank you very much, Reda, and I'm encouraging our men, our brothers who have stories around resolving gender barriers to immunization. You have the opportunity now to raise your hand, but I'm going to turn towards Dr. Joy Ataudi, whose mic is already open. Joy Ataudi, over to you. Share your story with us.
Thank you very much, Charlotte. Thank you, Reda. Thank you, everyone. Actually, I had an experience during one of our activities. Sorry, my name is Joy Ataudi. I'm a volunteer supervisor, immunization supervisor, and I work in Nigeria. And I'm opportune to work even at the national level, but I get sent to supervise immunization activities even at the community levels too. So during an activity, we were immunizing children, and we got to this particular house where the young mother, who was about 19 years old, insisted that she would not give her children release her children to be immunized. And that was simply because her husband had not permitted her husband had not given her the permission to release her children for immunization. So and her husband was not at home at the time for me to ask to get permission. So I was able to educate her, and I asked her, and she said, look, do not waste your time, because I will not release these children until my husband has agreed. She herself said that she knew the importance of the immunization and that she was willing, but until her husband gives the go ahead, she will not do that. So I took the time to trace her husband, and we were able finally to trace her husband, and I got him. After much begging, cajoling, explaining and all, we got him to grant the permission, not just for that particular round of immunizations, but for subsequent ones. And what was really important, what was really a big win for me, was being able to enlist him as one of the people to help even convince other men in the community to give such express permissions to their wives, even when they were not at home. Thank you. That's my story. So the other question is about what happened. The main, okay, I had said what happened, and the people involved.
Yeah, Joy, I think you covered it all. I'm looking to Charlotte.
Yeah.
Thank you. Thank you. Yes.
Thank you so much.
If you could just tell us, is there anything that surprised you?
Yeah, my surprise was that even though the woman, I expected that, well, she understood the importance of immunization and she was willing. But the fact that she said that even if she herself got sick, that she would not go to seek help until her husband was able to take her. So that's really surprised me, and that got us thinking as to what to do to begin to look at the root cause of such things and see how we can tackle that.
Thank you very much. Thank you so much for joining. I would like to, Emmanuel Katubwa, your mic is already open, so you are the first man to share your experience in this particular plenary. Please go ahead, and do not forget to introduce yourself.
Yeah, thank you, Reda. Sorry, thank you, Charlotte. Yeah, and Reda and every other person. Good afternoon, good morning, good evening. I am Katubwa Emmanuel. I work with the WHO in Nigeria, Yobe State, and I am an immunization expert, now reassigned to surveillance activities in the country. The situation I'm going to describe now happened while I was in my former station in Adamawa State of Nigeria. I actually went to a health facility to do some routine immunization, supportive supervision. And yeah, fair enough, the health worker there was a female, is a female, and at the end of all the, the filling of the checklist, on the ODK, you go out to carry out this community survey, just to see the status of immunization in that community where the health facility is located. And I went out and I started my survey and came to this house where I saw 2 eligible children on the one children. Actually, they were just about a month old. They were twins. And I looked at the immunization cards and I saw that these are 0-dose children. They didn't have immunization cards. And I asked the woman, what happened that your children are not immunized? And well, she said, well, she didn't give birth to them here. She gave birth to them in another place, and they came here to, to where the parents are. I said, okay, but in this area, there is a facility and they offer immunization services. And she said, well, she cannot go out until 40 days after the birth of these children. Wow, that was actually the gender-related barrier. And the good thing is that, of course, she believed in immunization, but because of this barrier, okay, she just took everything for granted and didn't really bother, asking where such services could be gotten. Fair enough, there was her younger sister in the house who was, old enough, to carry these children to the health facility. So I asked, I said, now, this lady by your side, who is she? She said, she's my sister. I said, good. If you can't go out within 40 days of the birth of these children, your sister, okay, could carry these children to the health facility where they could be immunized. She said, oh, that's true. I said, fine, if there's no problem, why not? Let her come along. We will take the children to the health facility for vaccination. Good enough, there is this daily immunization going on in some health facilities in Nigeria. So that was how we took those children to the facility and they were immunized. And I told the female health worker, I said, look, you don't seem to have any problem in this community. It's like a lot of your clients are very compliant, but look at even within, this high acceptance level, we're getting we're getting some 0-dose children in your settlement. That means you need to do a lot more to try and capture this kind of children in your community. And it turned out very well that, well, those children got immunized even without the woman coming out. So nothing much surprised me. It's just that the environment was a very compliant community. She just happened to be found in that community, and good enough during this community survey, we found her out and we were able to immunize her. Another thing I'll also advise is that women should always talk to their fellow women in communities, if the awareness is high. I guess one of the women, one of her neighbors in that area should have, have initial encourage her to, or encourage these children to be immunized, just like we did. Thank you, and over, Charlie.
Okay, thank you so much, Emmanuel Katugwa, for sharing this experience. I would like now to turn to, we have so many hands raised and so little time. So I'd like to turn directly towards Carolina Kosile. Carolina, are you able to unmute yourself?
Yes, please.
Please,
yeah.
go ahead.
Good day, everyone. I'm very happy to be on this call. My name is Caroline Nakoshile, Communication for Development Specialist. I worked for UNICEF Nigeria at a regional level in Lagos and Akure office in Nigeria. And basically the questions today, the first question talks about a situation that happened that is mainly gender related. Well, it was during an immunization session in Jigawa State, house to house, and we got to a house with a child, a zero-dose baby, and it was on supervision and it was reported. So we saw the issue as a gender barrier, decision making, and the norms and culture related. But the mother of the baby said she had to wait for her husband, just like a colleague has said before. So we waited for her husband to come back, but he refused. But we had to also talk to the gatekeeper of that community. He was the one who now convinced the man, and the child was vaccinated. Ordinarily, the woman of the house does not have the power to make decisions on her own on the son's health because of different rules that are dictated by the society, gender norms and values. So there was this also the issue of lack of education, because if the woman was really educated and informed about the survival and health of her baby, I'm sure she would have found a way to say, okay, maybe the baby should be immunized, or talk to the husband, or go to the gatekeeper in the community who we saw that really supported immunization. So what happened that day was really gender related, and it's a barrier. And the issue in that community is the one that speaks to power relations, whereby the male, the husband, wields more power due to tradition, due to culture and norms. So the woman lacks decision-making autonomy. She cannot make any decision without the husband. And the woman also is illiterate. She doesn't work. Even if she wants to take the child to the clinic, she doesn't have the money for transportation. So here comes inequity and inequality with the man. So who were the individuals involved, and what gender do they identify with? The individual involved are the young mother, whose power in society as a woman was little because of her gender, and a man, her husband, who is a decision maker. And the last person involved was the innocent child, that boy, the zero-dose boys, who was in the middle of this decision making between the man and the woman. And then our role that time was facilitating as government partner, as development partner, and as a supervisor during the immunization days. And then our role was also to make sure that every eligible child was immunized in that place, and despite the power situation on the ground. Then the fifth question talks about what did we do? Well, we spoke to the person that had the power of decision making, who was the father of the child, and also the gatekeeper of the community, who we were lucky to be on our side. So he persuaded the father, and then also made sure that all the children in that community henceforth were actually vaccinated. It went out well. It turned out very well because the children were now immunized. Then was there anything that actually surprised me? Not really, because gender inequity in health occurs between men and women in some parts of the world, not just only Nigeria. Men are supposed to be the decision makers, and this poses barriers for women and girls to access health information, and they can't make decisions, and they also have limited access to finances. Also, education is a problem because they have literacy level that's very low. So basically, the woman, if she was educated, she would have known that it's good for her to educate her child. Thank you very much, Reda and Charlotte and all our facilitators. I'm very happy to be on this. cause.
Thank you very much
Thank
indeed.
you very much.
Now the time is cruel because we have 5 minutes for our final speaker, and then we will have 90 seconds each for for two of our guides on the side, Aftab Kawaja and Shubo Rashid Jalal Ruzbani, to share their final thoughts before we close this plenary. Charlotte, over to you.
I'd like to invite Matthew Joker Matthew from South Sudan. Are you able to unmute yourself?
Thank you very much for this opportunity. I'm called Matthew Joker. I'm from South Sudan. I work for WHO. I started work as EPI from 2000 until now. The situation that I went through was during the polio campaigns. There are a lot of situations that we went through, but one of the situations that actually I was very impressed and I was really happy was one of the during one of the campaign, one village, the whole village refused to take polio vaccines. So we mobilized ourselves at the state level with all the stakeholders, including the council director. And we invited the chiefs, the women group, and the youth group, and all the members to come for the meeting. So during the meeting, the whole mothers refused that they are the people who suffered with their children and they cannot actually give their children for immunization. They don't want, because this polio is a vaccine that is going to stop them from producing. So they don't want they don't want their children to be vaccinated. So they continued, because I don't know the dialects. So I was there was a time that I was given time to speak. The first question that I ask you now, you have the right because it's your child, but I have a question. Why do you allow yourself to conceive and you stay with a child in your womb for 9 months, suffering with your child, until you deliver the child, and now you abandon your child to the disease that can be prevented? That's number one question. Number two question, I ask the chief, if suppose we came with 10 children crippled and one child that is well immunized and healthy, which of the two you will take? All of them say they will take the one child. I say, why? The 10 are more, and this one is only one. Why are you wanting to take only one child? They say, because this is healthy now. I say, okay, if that is the reason, now you have to immunize your children so that your children may become healthy like this one child that all of you agree to take. So from that meeting, the chief, the women group, and the youth group leaders, they all agree. Okay, now if that is the situation, from today, they wanted all the children in that village to be immunized, and the chief has to give orders that from tomorrow, let the vaccine be brought, and I have to be there, so that I have to witness that all the children are immunized in that village. And that was the first time that the village was fully vaccinated. All children were vaccinated by that day. And that was when I became very happy. And in immunization, we have to make sure that we involve all the stakeholders. For example, the chiefs, the women group, the youth group, and other stakeholders, so that we can give them the real message about the immunization and about the disease itself, so that they can understand. After understanding, they are the one to take decision, because they own their children, but we have to tell them the difference, the burden of the disease, and the benefit of taking vaccines. I think I will not take time. That's what I have. Thank you so much, and thank you for giving me this opportunity.
Thank you very much indeed. We're now going to give, and this feels really unfair. We're going to give 90 seconds to Aftab and Shubo, 90 seconds each to share their final parting thoughts. And I hope that this is only a stepping stone to the kind of dialogue between global and local partners, between global and local practitioners that we'll be able to imagine and then make happen together. We started with Aftab last time, so let's start with Shubo and then Aftab.
Thank you very much, Reda, and thank you very much, colleagues Matthew, Emmanuel, Jaya, and So thank you very much for sharing those experiences. Two things that came out for me. One is the importance of gender analysis, because it is the root causes. We are sitting behind the desk and we're planning our immunization team, but planning, and we do wonderful outreach. But then if we do not understand what is it exactly the basic barrier at the household level, we will not be able to solve the problem. So gender analysis is a key message that I want to pass through the session. And it is really important in the planning stage, in the implementation stage, and in the monitoring stage. That's number one. Second, because you heard all the stories, her husband doesn't accept, the religious don't accept, the cultural norm is that. So we need to know those to be able to say, yes, our vaccination will succeed or not. The second thing is the investment in local solutions. So the example from engaging one father that has actually led to engaging other fathers in the community. It's an investment, a cost-effective investment. The engagement of women groups in the example that Matthew shared with us is a simple way of addressing a big issue. The example that Dr. Emmanuel has shared with us is, look at that, very simple answer, very simple solution. Let the sister take the child. So he did not challenge the norms. He actually addressed them and accommodated them. So simple solutions, investment in local solutions are really important aspect that we need. These are the things I heard. I want to add one important aspect, which from my side, the capacity of health worker in convincing, the communication skills of the health workers in convincing. How do you convince a father that is rejecting because of religious leaders? How do you convince a father who is rejecting because he read this article on the internet that immunization causes autism? How can you convince? That communication skills, convincing strategies is really an important empowerment component that I would add to every training component for health workers. Thank you.
All right, thank you very much, Shubo Rashid Jalal Ruzbani. A final word from Aftab, and it'll have to be much shorter than your colleagues.
Thank you so much, colleagues, and thank you so much, Emmanuel, Carolina, and Matthews. When I was listening, it seems that I'm directly interacting with at household level with mother. It's not that I'm listening, colleagues, and thank you so much for really sharing your experience from the ground. So, in summary, I will bring another aspect of our immunization service delivery, and it's the immunization system, resilient immunization system, system strengthening aspect. I mean, colleagues have witnessed and shared the bottlenecks identified at household level, which relates both to the supply side of the system and demand side of the system, by caregivers and by our supply side. So how now these bottlenecks have been identified? Our colleagues have taken a kind of exceptional corrective measures on ground. But what I was asking myself, so whether we have that resilient immunization system where gender sensitive, all these gender sensitive strategies are being implemented to have this kind of long-term solution, long-term local solution, as Shabo mentioned, of all these bottlenecks. So what I will suggest that we need to have a kind of, we need to establish those community platforms at community level, where we need to empower the communities to access these services more effectively. A second is the missed opportunity. I mean, we need to consider those missed opportunities and like these deliveries at maternity home, vaccination at maternity home, outreaches, and empower our female caregivers and workers to address these issues.
Thank you, Aftab. 5, 4, 3, 2, and 1. This is the opening ceremony. We're pleased to announce that it's in partnership for the second time with UNICEF. I'll be introducing, with Charlotte, we'll be introducing our guide on the side for this session that will be accompanying participants of Teach to Reach, sharing their global expertise, but also very much listening to what you are bringing to the table. But before we start, we did this during the warm-up, but we're going to do it again. Charlotte, over to you.
Thank you, Reda. My mother is a hero in immunization. Her being a housewife and with no formal employment, she ensured that my 5 siblings and I all received the childhood vaccines as scheduled. She kept all the vaccination cards as a proof of the same in her adulthood. Now she is the main advocate for immunizations in our large family setup. She monitors and supervises to ensure all her grandchildren and indeed great-grandchildren are vaccinated as scheduled. Her immense belief in immunization and preventive health in the fight of childhood diseases is superb. She has influenced young village women in matters of health and specifically on scheduled timely vaccination for their children. I celebrate you, Mom. So this story is from Maurice Kyogora. He's a health facility staff from the Ministry of Health in Kenya.
A reminder of why we are here. In today's opening ceremony, we'll be hearing from women who deliver vaccines, but this is what we chose to open with. Now, a reminder for those who are just joining us now, this is the formal time for the opening ceremony. We'll be going into 3 networking sessions, and really the opening ceremony, the main plenary, will help you prepare to go into the networking session to have hopefully useful discussions, constructive sharing of experience around these 3 networking themes. So first, we will invite you to share a practice for recovery of immunization services. Second, with UNICEF, we'll be exploring interpersonal communication. And third, we'll be challenging you to find the root causes of your challenge. But let's go back to what this is all about. Now, I think in most countries there is a saying like this: if you want to walk far, walk together. And on 7th of March 2022, 6,185, to give you the exact number, professionals from 110 countries committed to build together, to launch and to contribute to a global movement for Immunization Agenda. Now, today we are 12,398. Actually, this was in June. Believe it or not, we're already 6,599 Anglophones at Teach to Reach 6, as this is a regular event. And today, 13,676 health professionals from all over the world. And if you've joined Teach to Reach for the first time, welcome to the Teach to Reach family. The Movement for Immunization Agenda 2030 will be inviting you to join. You're now part of the world's largest platform for immunization managers. It is not only about the information we send you, we share with you, the global knowledge. It is very much about, as you can see, the connections that you can build through networking events like this one. So absolutely amazing. And we will be sending out the call, sharing the call with you to join the movement for immunization. However, the way we wanted to start this opening ceremony was by asking the collective of women who deliver vaccines to speak. And there are many challenges to actually getting to a place where you are in the Zoom studio with us. I'm hoping, Charlotte, that you have a speaker from the Women Who Deliver Vaccines collective ready to go.
Yes, Reda. And thank you so much. We know that the collective of women who deliver vaccines, it's a come together of 138 women from 35 countries that are working to recognize, to give voice to all of the women from health facilities, districts, regions, national and global level, to give voice on what they are doing to make a difference as far as immunization is concerned. And we are so honored that we have the opportunity today to open this Teach to Reach Connect event. And I want to invite Dr. Tiala Kokpo, that's joining us today from Botswana. Are you able to unmute yourself to share with everyone gathered here today what you have to say as a woman who delivers vaccines? Over to you. I see you're unmuted already.
A pleasant good morning, good afternoon.
I hope you're connected.
Hello.
Yes, we can hear you now.
Okay. Good morning, Charlotte. Good afternoon, good evening to everyone and all of you wonderful people all over the world connected to this Teach to Reach 7 network. I am excited to be joining you all to interact with people around the world. My name is Dr. Tiala Koko. I'm a polio vaccine and disease surveillance and certification consultant from Liberia, but currently working in Botswana and other South African countries. And I'm very excited to be sharing my story today, sharing ideas, information, as a woman who delivers vaccine. Thank you very much.
And thank you very much indeed, Dr. Tiala Korkpoor. Charlotte, do you have questions for Dr. Tiala Korkpoor? Or shall we go to our next speaker?
No, we'll listen to Dr. Tiala Korkpoor. Dr. Tiala, as a woman who delivers vaccine, you have heard about from the WHO and UNICEF VUNIC report, you heard about that we are experiencing the greatest backslide in immunization history over the past 2 decades. So how does this affect you, and how can women specifically make a difference to build back better?
Thank you, Charlotte. COVID-19 has indeed disrupted routine immunization and had a very considerable impact on essential immunization activities. And as a woman who delivers vaccines, this is a setback to most of the gains that we have made, especially over the last decades in immunization. But it, however, challenges me to want to work more in reaching these infants who have missed the opportunity for vaccination, to ensure that they are vaccinated, as well as to also provide guidance to governments and key immunization stakeholders to mitigate these effects. Women tend to have the main responsibility, so to speak, for ensuring our children's health. And I believe that women can empower each other. That will mean that women empowering other women, meaning we will have more children that will get access to vaccine and educate each other on the importance of life-saving vaccines. I believe women around the world should also get involved in community efforts to include demand creation, community mobilization for vaccination exercises, as well as addressing vaccine false perception, especially during these COVID times. That will also help to mitigate this backslide. Women who also deliver vaccines like myself, as I'm doing now, can share their experiences from working during the pandemic that will also inform strategies geared towards regaining the gains lost in immunization during the pandemic.
Okay, thank you. We asked men this question: what actions are you taking as a man to support women who work in immunization, and why? So I'm asking you now, what kind of support from men will actually help you as a woman in your work?
I believe for an optimum immunization coverage to be achieved, it requires the full participation of the community. And when we say community, it involves both men and women, and it's not just a gender selective matter. So particularly, men and women must equally participate and be involved in vaccination activities in the community. But particularly for men, you will find that in most homes, especially where I'm come from, men have the voices in the homes, meaning they are listened to, their wives look up to them for guidance and direction. And so I believe men should enroll themselves and participate in men groups, in social groups, to first and foremost educate themselves on the benefits and importance of vaccines. They say knowledge is power. So I believe if men are adequately educated and know the value and importance of these life-saving vaccines we are trying to deliver, they will be able to educate their partners and ensure that their children are vaccinated. Men can also provide emotional support by, once they are educated, reminding their partners to take the children to the health facility for vaccines. They can also provide financial support, that is to also actually ensure that the mother can reach the health facility, either by ensuring that they are transported or by physically accompanying them to the health facility. I believe if men get involved in vaccine and vaccine issues within the communities and adequately support their partners in these different ways, women who deliver vaccines, our work will be a lot successful. Thank you.
Okay, women are fewer. I'll have this last question for you. Women are fewer than men in the movement for Immunization Agenda 2030. What contribution have women made to the movement so far? And what do we need to do to include more women? And lastly, where do you see yourself as an immunization professional in 2030? And what do you think the contribution of women will be for IA 2030 goals to be attained?
Thank you, Charlotte. I believe that I am here today sharing my experience, sharing information and idea as a woman who delivers vaccine. Is a clear demonstration and a true manifestation of women's devotion and contribution to the movement. It shows that women are dedicated, and when I say this, I don't just speak for myself, but I'm speaking for most women and women around the world, and committed to this movement and the drive that it brings. I also believe that the onus is on us as women to spread the knowledge we get from this movement, to share the ideas, to tell our fellow women around the world and encourage them to participate in this very great initiative. And by 2020, nothing else will bring me more satisfaction than seeing the IA 2020 agenda met and sustained, with women involvement being an integral part of the gains. Thank you.
Thank you very much indeed. Right, let's believe Charlotte that there is
we are going to listen to one more woman who delivers vaccines. I'm inviting Faiza Rabani. Your mic is already unmuted. Please go ahead and introduce yourself.
Assalamu alaikum, and hi to all the members and all the participants on the format of Teach to Reach forum. This is a largest opportunity where you can meet so many people from all around the world who are working for increasing the vaccination coverage in their respective countries. And I would like to introduce myself. My name is Dr. Faiza Arbani. I'm from Ministry of National Health Services, Pakistan. And right now I'm working in the Border Health Services and the Ministry of National Health, where we deal with all the vaccination services which are given under the international health regulations. We primarily deal with the yellow fever vaccination, we deal with the polio immunization, and we deal with the meningitis vaccination and the COVID vaccination. This is my current job description. But the wonderful thing about being connected with the Teach to Reach and the Geneva Learning Foundation, that it dragged me out of the main ministry from policy making to become a proactive member or to join a place where I can actually deliver vaccines. So this is my introduction, and I'm really thankful to you. In a 1 year's time, they've just changed me from someone sitting in the office and doing or reading articles on vaccination and how to improve coverage and how to take vaccination to the primary health care level and for the universal health care coverage. They've just turned me into a vaccination provider or a vaccination leader in my country. Thank you very much.
Thank you so much, Faiza Rabani. I have just one question for you. So for the second time, UNICEF is a partner for Teach to Reach. What is one specific action that UNICEF could take to better support women who work in immunization? Faiza?
So Faiza may have the same. Yep, she just dropped out of the Zoom studio. We won't know if there are others who'd like to answer that question in the hop-in. There's sort of many messages from Harira Suleiman, Dr. Suresh Kumar Shukla, Satabdi Mitra, Harira Suleiman, Dauda Hanania. If you'd like to answer Charlotte's question, what is one thing that our partner, UNICEF, one concrete action that UNICEF could take? Of course, the focus in this Teach to Reach is on interpersonal communication, but we couldn't not ask the question. Is that right, Charlotte?
Yeah, Reda, I was wondering, another woman who delivers vaccines, whether she could answer that question. Jane Rebecca Ulloch, I don't know if you're able to unmute yourself. Your connectivity will allow so that you can just take on that question. If not, probably we'll move forward.
All right, I suggest we keep moving then. We're almost out of time. It's incredible just how quickly time goes by. We're at the 47-minute mark, so we have 13 minutes left in this session. Okay, Faiza, I think, has managed to reconnect. Let's keep moving. Faiza, if you'd like to share your response to... Okay, here. Faiza, yes, are you able... Did you hear Charlotte's question? Are you able to provide a concise answer before we call on the men in our studio as well as in throughout Teach to Reach to answer the question about what actions they're taking? Faiza? All right, I don't think it's going to work, unfortunately. Yes? All right, so for those of you...
As a man,
No, so Charlotte's question was what actions, what is one concrete action that you would like, you think that UNICEF could take in order to better support women in immunization?
Okay. Unfortunately, Pakistan has undergone largest floods this year, and we are in a phase of catastrophe, a natural catastrophe, and these things have taken back the things many years behind. So we need support from all the, as Pakistan has a very low female literacy rate and we have low indicators of women empowerment. And at present, as we are faced with massive floods affecting 1/3 of the country in most of the underdeveloped areas, we have loss of life, destruction of primary healthcare facilities, homes, livelihoods, schools, infrastructure, crops and livestock, with the shortage of safe drinking water, personal hygiene, sanitation, shelter, and access to healthcare, with eruption of water and foodborne diseases, poor sanitation, snake bites, communicable diseases, vector-borne diseases as epidemics in our relief camps. So we are receiving help from the national and international donors and relief agencies, but through this forum, I would urge the entire audience and the donor agencies like UNICEF and other partners today to step forward and help us in the rehabilitation process to rebuild and restart the existing preventive programs for the special emphasis on creating linkages for accessibility, availability, and affordability of vaccine-preventable diseases. Because right now, as I told you, we have poor indicators things have been affected adversely. So this is a forum where I can request all of you that together we can, and together we can make a difference. And I would like to urge all the female participants who are attending this forum today to step forward and help Pakistan in this moment of crisis.
Thank you, Faiza Rabbani. Of course, we stand in solidarity with Pakistan that has just suffered massive flooding, unprecedented, as well as all the other countries that are currently facing the risk of disaster or striving to recover from disasters. Thank you, Faiza Rabbani, for this call to action and call to solidarity. Now, I've been showing this, I've showed this screen several times. You may be wondering, what is this? Well, we were struck in the last Teach to Reach, both in March and June, the extent to which men who deliver vaccines expressed their solidarity. And so we wanted to know, what actions are you taking as a man to support women who work in immunization, and why? And there is, let's see if Dr. Sunil's story, who says, we don't want your sympathy, it's a matter of equity and respect. So I don't know if that's, who is saying that, Charlotte? That's probably not Dr. Sunil, right?
Yeah, that's a woman.
Okay, yes. So can you tell us the story? Dr. Sunil is not in the room with us in the Zoom studio. So let's hear what...
He had an appointment and will be joining later.
Okay.
So, yeah. So he actually talking about where he was working, the very first female officer was appointed to join their office that was all male. And in the beginning, he felt she wasn't very uncomfortable being alone. But they, as a team, they decided to make the office comfortable and in order to boost her confidence as a woman. So, and he says his belief is that treating and respecting women equally, like the men, can help them to boost their confidence and become better, create a safer and more comfortable working environment for them. That's why he captioned his story, keep putting himself in the place of a woman, say, women, that we don't want your sympathy, we want more respect and equity.
Understood.
And that's what he's trying to do.
Thank you, Charlotte. Now, who shall be the first speaker of the men who responded and said, I am taking concrete actions to support women who work in immunization?
I am inviting Rajat Garg to unmute. Rajat, your hand is, are you able to unmute yourself? Over to you.
Yeah, thank you. Firstly, I would like to congratulate the TGLF Foundation for organizing this great event, and so that they're providing an opportunity for us to cross-learn and engage with participants from other countries. So thank you for that. And regarding my story, I would like to tell you that
Rajat, it sounds like you have a lot of background noise. Is there anything you can do to isolate away from the noise? We're struggling to hear your story.
Yeah. So is my voice more clear now? Is my voice more clear now?
Yes. If you speak really loud, close to your microphone, that's likely to make it a lot better.
Yeah. Okay. Yeah. So my story is like I was working as an immunization professional. One of the districts in Uttar Pradesh, India, that is Saharanpur. And the women vaccinators, the problem that they were facing is that there were few problems. One was that the area was hard to reach. That is, from the block, they had to go to the village. And that village was hard to reach, and it was far flung from the block. So that was the first challenge. Second challenge that the women vaccinator were facing was that they want a safe place to conduct the vaccination session in the village, and that space should have the washroom facility, because that is one challenge that the female vaccinator face in the outreach session. So to address those challenges, that's why they were finding it challenging to conduct those sessions. And then there were some families, there were some, there are some people sometimes who are not very friendly with the women, and women sometimes feel unsafe going to some areas. So to address those challenges, what was done was mobility support was provided to the vaccinators, female vaccinators, from the block to the village. So that is the first part. and it was ensured that one male member accompanied them from the block to the village side so that they feel safe. Thirdly, one session site was identified with a washroom because that village was actually at that time there was this not many houses were having toilets. So what was done was that there was a meeting with the village sarpanch, that is the head of the village, and one house was identified in which the session could be done, and the female vaccinators had the access to the toilets, washrooms in that house. So that was provided. And finally, regarding the security challenge, because you know that they have to go to some areas of the village which the mobilizers were not feeling very safe. So to handle that, I think again the village headman was taken into confidence, and he actually talked with the local influencers to ensure that the people who were creating mess or the vaccinators, they were actually taken care of, and the mobilization could be done in a smoother way. So 4 actions that were taken was firstly mobility support, secondly providing them space with washroom facilities for vaccination, thirdly the advocacy with the local influencers to ensure that there is a safe environment for mobilization of children, and also this one male person from the block PHC accompanied the ANM to the session site. So these were the 4 interventions that were taken, and I think it helped in improving the coverage in that area and also the confidence of female vaccinators. Thank you, Charlotte and Rita.
Thank you very much indeed, Rajat Garg. I see some great messages in our studio. So Charles Agbekpo, who says men can't do without women and men can do without women when vaccination taken into consideration, community participation. Philomena Boduwa Opuku, who says education to women should be more. Charles follows up with the same comment. And Obed Philippe Nuobe from Ghana, connecting from Agona and Kwanta in Ghana, says happy to be part of this session. In fact, women who deliver vaccines to our children needs great support from men. I've been supporting them diligently to ensure this is achieved, even in the just ended round 2 national NOPV2 campaign. So we have 3 minutes left. Charlotte, should we try to hear one more testimonial? All right, Melese, let us hear what Ethiopian men are doing to support women who work in immunization and why.
Yeah, can you hear me?
Yes, loud and clear. So you see the question on your screen. What actions are you taking as a man to support women who work in immunization and why?
Yeah, thank you. Let me introduce myself for just to be brief. My name is Melese from Ethiopia, Addis Ababa, working in Armahas Research Institute in Ministry of Health, Ethiopia. And I'm a researcher now. I'm just really focused on immunization practice, immunization programs, as I was working a lot in this program. So I'm really happy to be reconnect with this session. So I'm delighted with women's working in immunization program. So women's in any different environment, in any position, they are detailed, they are concerned, they are actually more perfect when being and just and also trusted.
Melissa, you have 1 minute to share your message.
As we're time, women are more influential in working immunization because most of the children are really linked with mothers, and mothers really linked with children. So I'm really happy to just help assist and work together with women immunization professionals, and I just delighted. Yeah, this is one thing.
All right, wonderful. Thank you very much indeed to you. Now, this session didn't quite work out the way we had planned it, but it's still wonderful to hear these voices in the room, in our Zoom studio, and to read many, many messages across social media as well as in the Hopin platform. Now, just a word of warning, as soon as we go into networking, you will have to join the platform you're seeing on your screen. You can, let's see, so Dauda Hanania says, all right, most of our health workers in Nigeria, especially the routine focal persons, are females. As an organization, we support them to conduct outreach sessions, taking vaccines to settlements that are hard to reach. Kingsley also has many, many more things to say. Now, it is time to go to the main plenary. And a warm welcome to those of you who are just joining us for the plenary now. This is a very exciting plenary in which we'll be exploring everything that is going to be happening in the rest of Teach to Reach, meaning in particular the networking sessions. And now it is also very solemn plenary because of the following. In July, WHO and UNICEF published the latest, most up-to-date and reliable data about vaccination coverage in every country of the world, and for the third or second year in a row, but going into the third year, it is clear that the COVID-19 pandemic has fueled the largest continued backslide in vaccinations in 3 decades. At Teach to Reach 6, we asked you, is this challenge of interest to you? You work at the local level. You may be seeing something that is completely different from the global level numbers, and asking you, how do we build back better to prepare for the next pandemic? So that will be the first part of the plenary, and then we'll be going into the networking sessions, especially the interpersonal communication session, where we'll be spending most of our time. We'll be introducing our guide on the side, Charles Kakaire, who is with us. We'll be introducing him, and we'll be asking him to listen, to learn, and to share back global knowledge that may be useful and relevant to local practitioners. So the first set of stories we're going to hear is about how local practitioners are responding to what at the global level looks like a continued backslide. Charlotte, I'm turning to you for the first speaker. I do see that we have an amazing story from Pamela Besong from Cameroon, who says COVID-19 vaccines were introduced in April 2021. He conducted national immunization days. And
we can see the slide.
All right. Yes, I see that. Okay. Yep. Let me see. Okay, there. You should see it now. Is that better?
Yeah, that's better.
All right. Okay. Yeah. So this is Pamela's story. And let me see if I can fix that. Yep. We're almost there. So the COVID-19 vaccines were introduced in April 2021. And then that means you didn't see the press release from UNICEF and WHO or the Teach to Reach challenge. How do we build back better to prepare for the next pandemic? Now, Pamela's story. The main challenge here were rumors circulating in the community that COVID-19 vaccines were now administered orally to children. Communication experts did the best they could, but many parents still refused for their children to receive any vaccine. And then the pandemic as a whole contributed to a decrease in visits to health centers due to fear. All the above and the insecurity context added to it in the region affected uptake. Now she ends on a note of optimism. Nonetheless, we're observing an improvement in acceptance as seen by the performance of 2 national campaigns. Charlotte, is Pamela with us? I see...
No, Reda, she's not in the room.
Okay,
but we can invite others in the room. What are you doing in your context to build back better? What was the impact of the COVID-19 pandemic on your immunization, and what are you doing right now to make a difference?
That's right. So first person let's hear from Melese, who only got like a minute and a half to share what he's doing as a man. Melese, we'd love to hear more from you, but this time on this topic, as you know, dramatic drop, continued backslide in vaccinations. We lost 11 years of hard work to bring coverage up. Tell us where you work and tell us what you're seeing and what you're doing about it.
Yeah. Thank you, Rhoda and Charlotte, to give me the chance to introduce and to tell me the current situation in Ethiopia, especially in immunization program. As you said, COVID-19 affects different programs, especially increase the communicable disease problems and backslide with immunization programs for the last 2 years. In Ethiopia, there is actually currently identified huge zero-dose children and under-vaccinated children in different parts of the community. And also in Ethiopia, there are instabilities, actually, political instabilities that may also one factor to worsen the high zero-dose children and disadvantaged community in our country. So to address this, our Ministry of Health mainly focus on addressing these two main important problems, that to improve or to minimize the zero-dose children, as well as to minimize the disadvantaged populations as under vaccinated children. So doing this to just use overall of the effort of the resources and the financial and the human resources, integrating COVID-19 with a routine immunization program is recommended and not actually strategically designed, but recommended to be integrated. And we are just using differentiations to integrate and mobilize the community to get vaccinated in routine immunization as well as COVID-19 immunization.
So, Melissa, can you clarify, what system level do you work at in Ethiopia?
I'm working in Ministry of Health.
Okay, so at the national level?
Yeah, at the national level.
Okay.
There is a research department, and I'm also working in research.
Okay, and so can you tell us what was the change reported in these findings from UNICEF and WHO? What has been the drop in vaccination coverage in Ethiopia since 2020?
Yeah, actually, there is no current assessment that's made. That's to just say the amount of zero-dose children. There is no actually recent evidence. There is no recent survey. But when you go to the community, there are a lot of children that are not addressed, and there are a lot of children that are not fully immunized. So we need actually, yes, a survey that really shows the coverage of the immunization. But still, there is no recent data that figure out how much we are in immunization program.
Okay, thank you, Melissa. So you sound optimistic. It sounds like you've been doing a lot in Ethiopia. How do you reconcile the optimism, the will to make a change, and then these global numbers? How does that affect you?
Yeah, as you remember, in the immunization moment, actually, my action plan showed to integrate the routine immunization with the COVID-19 immunization. So this is the beginning that the recommendation is actually just accepted by the Ministry of Health, and there will be strategies that will be designed to integrate and use all the resources to address COVID-19 immunization program. So I'm optimistic, in a good position to just recover the immunization program, at least to the previous level. Yeah.
All right, thank you. So now let's go back to Charlotte. Charlotte, who shall we hear from next? Let me make sure Charlotte is still in the room. Charlotte, are you there?
Yes, yes. So let's try to turn towards Eunice Teya. Eunice Teya, exactly. Are you able? You're unmuted. Please go ahead and introduce yourself. Please unmute yourself again. I saw you were unmuted earlier on.
That's my fault. Yeah. All right, Eunice, please do introduce yourself.
Hello, good afternoon. Hello, good afternoon.
Good afternoon, Eunice.
Mrs. Eunice Ajagli, a health promotion officer at the regional level. It is true that COVID had affected general immunization for the fact that there become some sort of mistrust in the routine services, because people were thinking, with all the misinformation around, the vaccines are meant for evil implications on their life. So this is affecting the routine immunization. Unfortunately, we have a situation where a lot is invested into the vaccine acquisition, training of vaccinators, but little is done to equip those who are to go to the community and do the sensitization. So we fight after the rumors and misinformation instead of giving information earlier before the rumors and misinformation come in. And this had affected us a lot. And if you look at the number of people we send into the communities for the immunization and how well prepared they are, it is a bit of concern and worry because we have not been able to put a lot of people there. But what am I doing in my capacity? I've taken it upon myself to have personal orientation for my district officers and volunteers. I go into the community, the district, put them together, share with them current update on issues and good interpersonal communication skills that can make them to be able to reach out to people and ensure that they don't go just to talk, but get to understand how the people are thinking, how the misinformation are with them, what is influencing their behavior or action, and speak to the issue instead of giving blanket education and sensitization every day. Because I have assessed and realized most of the people sent out to do the communication only go and do one-way communication without listening to the people and knowing what actually is influencing their decision. So going forward, I even want to do some study into what is influencing people's decision and action in routine and then COVID vaccination and any subsequent future vaccination, which will inform that. Then with that, prepare a cohort of communicators who will be prepared by getting the understanding of what is happening now to be positioned to work now and to work into the future in case of any future outbreak. So that with that, taking into account the common say in sociology that one person can influence 10, with that, with time, we'll be able to have a lot of people who will be able to speak to the issues. And with that, they'll be able to get people to understand and make informed decisions and influence others to also accept and go for immunization routinely, that we can improve the immunization routine in Ghana, especially in Greater Accra region where I work. Thank you.
Thank you, Eunice Zagli. All right, before we go to the next speaker, let's see what's happening in the hop-in. So we have some very interesting messages. Demas Kunsei says from Papua New Guinea, says we need more women in the vaccine supply chain management. So referring to the earlier discussion we had, I'm a pharmacist and data management officer in the PNG MoveX project at the national level using mSupply as an ELMIS tool to manage vaccines and visibility. Thank you, Demas, for that. And then speaking to the discussion that's ongoing now. So if you join the plenary room late, you may have a delay in your in what you are seeing on the live stream. So this may explain why some comments are coming in after we've discussed them live. Anna Mauster from the UK says, really interesting on the need for two-way conversations. Makes a lot of sense. We all want to be listened to, not just told what to do. Now, let's keep going. We want to shift this plenary to focus on preparing for the networking sessions. So we asked you this question for those of you who were there for the warm-up session and the tutorial. Which networking session are you most interested in and why? That's not what we're going to do right now. We're going to introduce the 3 networking sessions and on each one share one story and then call for our guests in the studio to share their stories or to comment on the ones that they hear. Now, this is the moment when I am very pleased to introduce our guide on the side. So this should be in should be in English. Yeah, we just finished the French session, so there's some leftover content that's not yet translated. So I'm very pleased to introduce Charles Kakere from UNICEF HQ. He'll correct probably the pronunciation of his name, but Charles, a warm welcome to you. You are our guide on the side today. Could you briefly introduce yourself? What do you do at UNICEF?
Thank you very much, Reda. Just confirming that you can hear me okay?
Yes, loud and clear.
Thanks. Good morning, good afternoon, colleagues. My name is Charles Kakaire. I am the Social and Behavior Change Specialist Immunization Demand at UNICEF headquarters. And I work with a couple of other colleagues. My head of section, Deepa, is also available on the call, and we're happy to engage with the colleagues in the conversation around the personal communication, being able to hear from them who are on the front line about what the challenges are, what the success stories are, and what we could do together to improve this aspect of what the work that we do. Thanks, Reda.
Thank you, Charles. And yes, Deepa Rizal-Pocorel is the other guide on the side for today's session, together with Gloria Liemo and a Francophone colleague who is here with us in the session this morning. We'll have a big focus in today's Teach to Reach on interpersonal communication. We'll ask Charles and Deepa why they consider this to be so important. And of course, we'll ask you as we prepare for the networking session. So again, 3 sessions, Ideas Engine. This is actually a session that is happening now. So let's see, if I go to back to the platform, we haven't announced it. We wanted to keep everyone in the plenary as long as we could, but there is another networking session. Here's how it works. It's very simple. You go to the People tab and go to the Speed Networking, click on Join, and you'll be immediately connected with someone else from the conference, from the Teach to Reach, and be able to chat with them in increments of 5 minutes, but you're going to actually speak as long as you want. So that's a little bit of background for those of you who were not there for the warm-up session, in which we spent a lot more time explaining this. If you check your emails, you'll find a lot of information and instructions on how to do that. Now, after the networking session that is happening parallel to this main plenary, that is when we'll be going into the interpersonal communication, so networking 2. Again, the same place at that stage. If you're watching us in YouTube or Twitter or LinkedIn or Facebook, you're going to have to go to the Hopin platform to discuss interpersonal communication. And then for networking 3, the challenge will be to find the root cause of your immunization challenge. And this is about connecting with someone else. So you'll press on the button and you'll be talking to another immunization professional. You'll get to hear about their challenge and what they found to be the root cause of that challenge. And you can discuss that, compare notes, and so on. So that's really what we're doing. After this plenary, we'll be going into 2 more networking sessions. Some people we know just go straight to the networking, which is why we have a networking session concurrent with this plenary. In fact, at the original Teach to Reach conference in January 2021, there were 14,000 networking meetings. And that was when Charlotte and I looked at each other and we said, okay, there is a need here for immunization professionals to be able to speak to each other. And that is what we're trying to respond to with this Teach to Reach. Now, networking session 1, as you saw, we're going to do it live in the plenary. So I'm going to turn to Charlotte to identify who we'll hear from. And we have collected some great stories. People shared stories ahead of Teach to Reach. This one from Fatima Mohammed is called A True Life Story by a Female Religious Scholar. And she says that in her district in Nigeria, she was able to sensitize and engage religious women leaders in Damaturu who serve as role models at their respective Islamia schools by being vaccinated first in public, which serves as a means of most women being vaccinated. And they mostly testify that after they were fully vaccinated, those with history of asthma with constant attack now have no attack, which was indeed a miracle. That's how Fatima puts it. Now, this is an example of a practice shared. Now, this practice can be discussed. It may not be perfect. It may not completely adhere to all the guidelines, but this is how Fatima actually got the job done. So not sanctioning this, not saying that others should do this, but saying this is how the work of immunization actually happens. Charlotte, who shall we hear from first to share a practice that actually helped you in your daily work restore or strengthen your immunization service?
So we've had Abubakar Musa that's constantly been unmuting. Abubakar Musa, I don't know if you're able to unmute yourself to share an idea or practice. And if not, I'm going to invite Loco Musau. Loco Musau, are you able to unmute?
Hello.
Okay, Abubakar Musa.
All right, Abubakar Musa.
Yes, yes. Yes. Good evening to you all. I am Abubakar Musa from Nigeria, and I'm working under primary care at a facility level. I want to share my challenge is we have a serious challenge concerning immunization in our, most especially in a rural area, because the COVID-19 vaccination caused some serious problem. People are expecting, saying that that vaccination is just a vaccine given to their child so that they will die shortly. So such kind of things will not make them to come to the immunization. And serious cases are happening like measles outbreak, whooping cough, and so on and so forth. So I would like to call the attention of government and other policies makers to tackle the problem and think widely in order to know how to tackle the problem. Can you hear me?
Yes, Abubakar Musa. So the question is, can you describe something that you actually did that helped you to build back better, to restore or strengthen your immunization service?
Yes. Okay. I will just gather the community members, that is the well-to-do in the community, like religious leaders, community leaders, and traditional leaders. So we have deeply discussed on such countries, and we call the attention of this health education officer in our level how to tackle this problem, and thank God all things will be solved soon, inshallah. And we have seen a positive change because some are giving their child and they don't even believe on that what they have said concerning the COVID-19, saying that their child will be dying soon. So by now we are really looking so good with this change.
All right, thank you, Abubakar Musa. So we're looking to other speakers who are with us in the studio to share practice that has helped them restore or strengthen your immunization service. So Faiza Rabani, we heard you for women who deliver vaccines. We'd love to hear you share a practice in relation to what those of you who are going to networking session 1 are going to do with each other. What is the practice that you actually carried out that helped you restore or strengthen your immunization service, Faiza? Tell us.
Okay, thank you very much. Rida, I'm working on a module for the teachers training program in my country, where I will be using the teachers from the primary and the secondary level schools who are working at all the primary healthcare and primary teaching schools. They will be working as change agents. They will be working as advocates through their teacher training program. They will receive how to interpersonal communication skills with parents and with the students regarding the importance of immunization and the benefits the country can have with the extended immunization program. And that's why I'm working on that. And most of the teachers, they are willing to work as, not only work as change agents or work as public health advocates, they're also compelling their schools for mandatory vaccination of their students who are right now inducted in their schools. So this is, I'm doing it as a pilot project, and I would certainly like to share my findings as soon as my pilot project is concerned. So this is a very good opportunity I found within the limited resources we have in all the lower and middle income countries, to use our school teachers to work for us as advocates for basic immunization and the special immunization campaigns which are carried out in our country. Thank you.
Thank you very much indeed, Faiza. All right, let's see if we have other contributions. Let's go see what's happening in the hop-in space. Chika Ofor says compliance has improved in the area coverage, according to her, where she works in Nigeria. Nigeria has more boots on the ground, and the numbers are going up, she says. Chinwe Nwakanma says COVID-19 pandemic came with poor economic activities leading to high poverty rate. And this has led to a large extent vaccine hesitancy. Chinwe, we'd love to hear more. How do you see the relationship between poverty and vaccine hesitancy? She says people are more interested in food and survival than the COVID-19 vaccine is presumably what she's saying. Angela Quay, and what you can do if you see a response that you like to show your support, to show your appreciation, is again, click on the little thumbs up. From Angela Quay, indeed, COVID-19 really affected the uptake of the immunization services in the region I work in. Most caregivers think the routine vaccine being received by the children are a trap to give the COVID-19 vaccines to the children. Of course, that is absolutely not true. What we did and are doing differently is to introduce the community and one-on-one engagement with key stakeholders, especially chiefs, Queen Mother, religious leaders and caregivers, especially the fathers who are the decision makers at home. Wow. Okay. That's we'd like to know the specifics of that in order to better understand. This is networking session 1, which is actually going on right now, just to give you a flavor of what we'll be discussing. Before we talk with our guides on the side from UNICEF, we want to yes.
I would like to share this practice from Anita Boateng in the chat here in the Zoom studio.
Okay, yes,
She
please
said,
do.
I think school immunization is also working for me. I wrote letters to head teachers of various schools to inform them, and they informed the parents about this because we noticed that after the first year, they don't bring children for vaccination. I did a survey and it seems it's because of school. So we communicated to parents, and now we have 2 days immunization schedule for school children, and it's helping.
All right, that is also kind of positive, constructive news. We'll be discussing issues like these with UNICEF, specifically focused on interpersonal communication. I suggest that we shift over to that. We do have networking session 3 about root cause analysis. So we'll do root cause analysis first, and then shift to the rest, to dedicate the rest of the time to the question of interpersonal communication, hearing really concrete stories again, and this time with the guides on the side from UNICEF who will be sharing back their feedback, their further questions, and their thoughts on what we can learn from stories like these. Now, networking 3 will be at the very end of Teach to Reach. It'll be the last session of the day. It'll be about finding the root cause. So there is a very simple question. Describe your challenge and then tell us what do you see as the root cause. So I see Prince Owusu Panahene Sarkodi. Let's see, Prince Owusu, you have your hand raised in our studio, so we'd love to hear from you, and I would like you to think of an immunization challenge before you unmute and call on others, of course, to do the same. We know each other in the Zoom room. We have really special guests, people that we wanted to honor by inviting them to to Teach to Reach, to be in the studio with us and to share their stories. I see, let's go to Paul Twine or Onojo Otowo and ask you to speak, as well as Pearl Chizobam Eke. And Charlotte, let's see, around this root cause, there was a lot of interest expressed when we announced this networking session. So I'm calling on Prince still, as well as others. Let's see, Loco Musao, Onojo Otowo, Paul Twine, asking you to unmute in order to ask you what is your challenge and what do you think the root cause is. And then we'll actually do it live, ask you 5 times why about what you think is the cause of your challenge. So please do not be shy. Raise your hand if you want to do it. But of course, if you're in the studio with us, it is because we want to honor you by enabling you, engaging with you, hearing from you, as well as listening to and learning from you. So let's see. We have... All right. Paul Twene. Paul, are you there? Are you able to speak to us?
Hi.
All right, wonderful. Oh, so this is Prince Owusu. All right, we'll make this work. So Prince, we can even see you on screen. So first of all, do introduce yourself. Tell us who you are and what you do.
Thank you very much for the opportunity. My name is Prince Owusu Banahine Sarkodie, and I'm with the Ghana Health Service in Ghana.
All right, thank you, Prince. And so what is a major significant immunization challenge that you face in your work? Tell us a little bit about what you do, and then tell us about something that's so far has remained difficult. It's still a challenge. All right, I think we've lost Prince. This sometimes happens. It's okay. I hope we get Prince back. Prince, are you able to speak to us? I think that was someone else. Let's try Pearl Chizobam and Charlotte. Please do let me know if you have.
I think Farm Daniel is unmuted, rather.
All right, so Daniel Kwesi Ekwam, also from Ghana, so we still have the country representation. Daniel, tell us, what was the immunization challenge that you took on in the movement for Immunization Agenda 2030?
Oh, thank you very much, Reda, Charlotte, and everybody. I think I took over on hesitancy, COVID-19 vaccination hesitancy.
Okay.
Among
and Daniel,
some people, yeah.
So you are a pharmacist. Explain to us how, as a pharmacist, you are confronted with COVID-19 vaccine hesitancy.
As I said, I'm a clinical pharmacy specialist and the director of pharmaceutical services of the Upper West Regional Hospital of Ghana. And so I'm at the regional level. And at doing my day-to-day activities, that is where I realized that I was just chatting with health professionals in my hospital to find out whether they have taken their vaccination. That is how it all started. And I realized that most of them, some of them have not taken. And when I look at the reasons they were given, some of them were given were all as a result of rumors of this COVID-19 vaccine, of which some of them thought it wasn't of good, it's not a good quality. Some of them have had a theory about it that is something that is wrong, and all those it will affect their health. So I decided, and then also about the adverse reaction, because it's a new vaccine, per what they are hearing on the social media, that it has a lot of adverse reactions. So it was made up of the rumors on the vaccine not being of good quality, and also on the possible adverse reactions when you take it.
So let me see if I understand this correctly. So initially you thought the cause of your challenge was misinformation and rumors, but when you did the situation analysis, when you looked for the root cause, what you found was different. It was that it was related to the adverse effects or fears of adverse effects of a COVID-19 vaccine. Is that correct?
No, what I was saying is that per the initial assessment with just a normal conversation with the staff, I realized that some of them were showing hesitancy in taking the vaccine. And the main reasons they were giving was the rumors of the drug being of poor quality, and at the same time, the fear of the possible adverse reactions when they take it.
Okay.
So that is what the information I had initially.
Yes.
So that made me to do a root cause analysis, to do that situational analysis to know the root cause of it. And with that, I came up and realized that yes, it was something that was embedded, that people were afraid of the adverse reactions, and at the same time, people had the notion that the vaccine is not good. But what really helped me in the course of my destiny was to use my own vaccination card to let them know that I have vaccinated. And if there is anything, I would have told them, and I'm fine. After the period, almost 1 month, 2 months, nothing has happened. I've taken it, and I'm a pharmacist. I use that as the knowledge I have on pharmacovigilance to be able to explain to them. And for now, a lot of people are taking the vaccines. That is what I can say.
Okay, so you went beyond root cause analysis and actually developed strategies based on what you found to be the root cause. So was the root cause that you found, how was it different from your initial assumption?
What I realized was that I had the main root cause was the rumors. That was the main root cause. And the second aspect I found, another root cause that I found was that the people saw that the rate at which there was public health education on the COVID-19 had reduced, because initially there was so much pragmatic step from all the health institutions and from political point of view, but they realized that because going for election that caveat, there was they made the restrictions, they lessened the restrictions. So people were thinking that if there was COVID-19, why was that they're doing the elections, before the elections and during the election, they lessen the restrictions. So that is another part of the root cause that I saw. Yeah.
So you unraveled actually many complexities as opposed to a single cause that would be responsible for everything. Is that?
Yes.
Okay.
Yes, please.
Understood. All right. And again, this is the last networking session of the day. So what we're doing here is a warm-up. This is Daniel Kwesi is a member of the Movement for Immunization Agenda 2030, has carried out root cause analysis. If you've never done it before, you can simply keep asking why. And if you ask why 5 times, you'll find a cause different from what you initially thought, very likely. And again, when that time comes, you'll be going to speed networking, clicking on join now, clicking on join, and that's where you'll be instantly connected, or within a few seconds, to someone else in the Teach to Reach 7. Now, I think we do have, I see Charlotte had said that Paul would be speaking next. I'm conscious of the time running. Let's see if we can weave Paul's story into the networking session 2. We shift now our focus to interpersonal communication. IPC, now it's not infection prevention and control. And this is the session that we're the networking session and the plenary that we are doing now with our guides from the side from UNICEF. So we have Charles Kakere and Deepa Risa, who is Rizal Pocorel from UNICEF HQ, who are with us. And Charlotte, let's see, we asked a very simple question to kick us off. What have you changed since 2020 in how you speak with caregivers and the community about vaccination? But before we do that, I want to ask Charles to introduce himself. He made a brief appearance on our Insights Live. We actually met in New York a few weeks ago together with the rest of the UNICEF team. Charles, a warm welcome to you. I'd like to ask you for something very simple to kick off. Can you give us a simple, clear definition of interpersonal communication?
Thank you very much, Reda. And again, glad meeting your colleagues. Interpersonal communication, I would simply define it as the exchange of information, ideas, and feelings among one or more individuals. I would. That's just how I would briefly explain that. So it's it's an engagement, it's a conversation, exchanging information, exchanging ideas, exchanging, feelings among one or two.
That's very clear. Now, Charles, you've been together with your UNICEF colleagues, you've been listening to a lot of these stories in the last 40 minutes, and I think even longer if you joined for the warm-up session. Would you say that interpersonal communication is kind of a running thread throughout all these stories? How health professionals actually talk to caregivers, to members of the community, the words they use, the attitudes they have, the behaviors around how they communicate. Is that kind of constant running thread no matter what the issue of the challenge is? Would you agree or disagree with that?
I would agree with that, Reda, and again, for a simple reason, that health workers are the most trusted sources of information, and therefore they have one of the biggest roles in ensuring that people get vaccinated, or that caregivers take the people within their hold for immunization. So yes, the issue around interpersonal communication, therefore, is a thread that certainly moves all through.
All right, thank you. And so we asked this question to the Teach to Reach participants when they registered, and to some of the leaders in the movement for Immunization Agenda 2030 since 2020. What has changed about how you speak with caregivers and other members of the community? And so you heard it was so touching and compelling. We read this story. Charlotte presented this story from Morris Kiogora, who works in a health facility in Kenya, who tells the story of his mother as a hero for immunization. Can you tell us, unfortunately, Morris is not in the studio with us, but what else would you want to know to understand this story? Why is this story important when it comes to interpersonal communication? Oh. Charles? Yeah, I think you're muted, so... All right, so this... Of course, this happens. There's some great messages from the chat. So let's wait until Charles is able to unmute again. So Faiza Rabani says, behavior change communication is the key to a fruitful interpersonal communication. She says, Emmanuel Ketugwa says, the discussions are quite interesting. I'm on transit and driving, so won't be able to speak. Fair enough. And he says that where he works, COVID-19 vaccinations are gradually increasing by the weeks. So I'm not sure what the issue is. Maybe Charles is, as almost everyone today has technical issues. Let me just see if there's a way. Okay, great. Charles, are you back?
Yes, I am.
All right. So this story by Morris Kiogora that's being shown on screen, we read it in the opening ceremony. We found it so compelling. What can we learn from a story like that? Where is the interpersonal communication involved? In Morris's story, he's talking about his mother as a hero for immunization. What is important and what lessons can we learn from this?
Thank you very much, Reda. So a couple of lessons that we learned reading Morris's story. One is around, the issues around influence or influencers, or the people that, we can rely on to help reach a larger number of people. We know that in every community, in every home, in every society, there's always that one or two individuals that hold or wield a large influence. So just being able to see how we capitalize on that influence and work with them to be able to help us reach out, to as many people that, as we could, is very helpful. That's sort of one of the lessons I would learn from that. But I think there's also issues around trust. Morris this definitely talks about the mother, talks about the mother. So there's also trust issues there. There's probably the element of somebody that you would be able to trust, with the people that you care, that you love about. So it's a combination of things, Reda. It's trust, it's about influence, it's about how we can utilize those levels of influence, be able to reach out to a larger number of people in our communities.
Fascinating. Thank you, Charles. Let's look at a second story before we turn to Teach to Reach participants. So this one is from Mariama, and I know she's here. I hope I hope she made it to the room and actually has a connectivity. No. Okay, so let's in her absence. I hope at least she's following us. Please let us know. Send us a message if you're watching this on YouTube or if you're in the hop-in space. Please let us know. We'd love to hear your voice to tell this story. And you say, Mariama, you shared, my punctuality in my work has improved. So we ask you, what are you doing differently since the COVID-19 pandemic arrived, let's say? And she says, I now know that I need to commence my work promptly so as to avoid clients' unnecessary delay. Also, I need to be polite in approaching them, give room for questions in case they have any. This matters because sometimes our attitudes to patients can discourage good turnout. I learned that with good behavior towards our clients, much can be achieved. Charles, back to you. What else would you like to know about Mariama's story, situation, journey, and what can we learn from her story?
So Reda, thank you again. Sort of just going back to when you asked me what the definition of interpersonal communication is, it's that, every time we talk about interpersonal communication, there's a tendency to believe that it's only about verbal communication, but it also goes beyond that to the non-verbal. Again, we said it's about exchanging information, its ideas, its feelings. So just by being able to appreciate, that interpersonal communication is about all those, that alone, becomes very helpful. The story definitely brings out the fact that, there's the empathy component in this, by being punctual, that alone, helps to improve, uptake of the service at your point, because again, we are trying to encourage people to come to the service point. So the way we treat it, it's basically customer care, if you want to look at it from the corporate side of things. A few things to learn from from Idris's story. Attitude is one of those, that indeed is clearly mentioned. There is the issue of just being available at the time when the people that we're serving, when they need us most, and also just being able to empathize with them, putting ourselves in their shoes, and sort of feeling what they feel. The same way we would feel, for example, if we went to a health facility and we were not being able to, to receive the service that would have taken us. Just being able to put ourselves in the shoes of the client is one of the things that we would just have to be very cognizant about. The other aspect again, Reda, just to in terms of thoughts, is being able to listen carefully to the concerns, fears, and issues that our clients, if we call them that way, have, and just being able to listen to them, assure them, provide the feedback, is very helpful in terms of just improving service uptake.
Thank you, Charles. So I have a question for you before we hear from Teach to Reach participants, and that is the following. Now, I understand that pretty much all the research about interpersonal communication in immunization staff finds that immunization staff could do a lot better. In some cases, it's even, it's clearly stating that immunization staff are ill-equipped for interpersonal communication. Is that a harsh judgment? How should an immunization staff who's working in very difficult circumstances, hearing this, what should they do? It feels like they're being accused that they're bad at their job, and yet they're the ones keeping immunization going. How would you respond to that? How can we be supportive and engage usefully with this evidence?
Thank you very much, Reda. I won't necessarily put it bluntly like that, Reda. I think just two things that I would say around this. One, Reda, is the fact that the research that you're referring to, this feedback comes from the community. It comes from the people that are coming to seek the service from the service point. So it's not coming from the technical people. It's the feedback that we hear from the communities.
Yep.
Remember, I did mention, Reda, that healthcare workers are the most trusted sources of information, and therefore they have a very big role to play in vaccination. So you have a situation, rather, where the people that the community trusts most, okay? The community trusts the health workers most, but they have a perception that when they go to the service point, they do not receive, it's sort of like there's a bit of a discrepancy between their expectation and what they actually receive. So that, I think, becomes the beginning point of the conversation. And it is the reason why we're having this, conversation, rather, with the colleagues who are on the front line, just to be able to hear from them. The fact that if this is what we hear from the people that are coming to seek the service, what, from their point of view, do they think it's, are some of the issues that would need to be addressed? But also just to ensure that we hear from them in terms of how this could be improved, what the challenges they are to ensuring that we can do better, but also just being able to hear from some of the success stories. I'm sure that there's loads of success stories out there, radar, some of which have been shared, but just being able to hear from those and see how those could be amplified or replicated elsewhere.
All right, thank you very much, Charles. Let's, in fact, turn to listening to Teach to Reach participants. Charlotte, who is ready to speak at this stage in our studio? There's also some very interesting, fascinating messages happening in the Hop-In conference platform.
We have Buka Alaji Ibrahim, whose microphone is already unmuted. Reda, I hope connectivity will allow him to share with us.
Our thoughts are with you, Bukar. Tell us, please introduce yourself, and then what, since 2020, so basically since the pandemic, what has changed in how you speak with caregivers and other members of the community? What have you changed, and what has changed in the environment? It looks like we may not be able to hear. Bukar? Yeah. All right. This is just some Teach to Reach. Everything is flawless and everyone has good connectivity, and others, is like today, it still will not prevent us from having an amazing experience in the individual networking. You'll be able to overcome these challenges with your peers. That's really the heart and soul of this event. I'm going to Marwa John, asking Marwa to unmute, as well as Rajat Garg. Marwa John, please introduce yourself, and what are you doing differently? What has changed for you with
Okay, thank you, Reda.
Yes, go ahead.
Hello. Yes, Mara John from Tarime, Tanzania. For the current situation that we encountered of COVID, there are some sorts of changes that happened, and it ended finding that some people got it hard to make it to the health facilities, and some of them were uncomfortable coming to seek health care services or vaccination to their kids, with the mentality that they will get a COVID jab without their consent, and also there might of their kids also getting the jab for
yes, Marwa, that we understand, but what did you do? What did you change about how you speak with caregivers and members of the community? What did you do differently in these circumstances that were unprecedented? No one had ever been confronted with this before, and yet you had to figure out how to keep immunization going. What did you do when it came to the words you used when speaking with caregivers? What did you say to reassure them? Did you change did you listen more? What changed about what your job and the interpersonal communication involved in it?
Okay, thank you. What I did first was to give enough elaboration to my co-workers who are the caregivers and the health facility providers on the importance of the immunization first, so that to make it clear to those who come to seek vaccination for their children. In a matter that we had to tell them that the vaccine first, how it works,
and at what ages is required or who are required to get the vaccine, so as to keep people free on seeking the healthcare services. In a matter that the situation was terrifying. Everyone who comes may say, I will contract the disease or the virus of COVID. So we had first of all to improve increase the number of staffs to work or to attend the patients so as to reduce the workloads. And also we increase the number of days on which the vaccine were to be provided till the Saturdays instead of ending on Friday, so as to reduce the congestion of the children we were giving vaccine to. And also we added the other outreach services in order to reduce the congestion at our facility through that time. And we welcomed the community health workers to work closely in also helping us to provide the education on COVID prevention and also COVID prevention measures. And also whenever there is any problem, they may seek quick health services in order to get more help. Thank you.
Thank you very much indeed, Marwa John. Let's hear from Samuel Majok. Samuel, and I think we're not respecting the rule of gender parity in these. So I encourage the women in our studio to raise their hands so we can see them. I'll go back to Charlotte, and then we'll turn to our guide on the side, Charles Kikere. Samuel, please do introduce yourself and tell us what has changed. How have you adapted since the arrival of the pandemic, and specifically on interpersonal communication? Because that's the next, in 4 minutes, that the networking session for interpersonal communication will be opening up. What are you doing differently? How are you speaking differently with caregivers? How are you communicating differently with caregivers and other members of a community? But first, introduce yourself.
Thank you so much. My name is Samuel Ajek. I work for Ministry of Health as a consultant for EPI. During COVID-19 in 2020, I have done a lot of work at subnational level and then national level. So basically, I was based at the subnational level. After my work, I was promoted to the national level. So let me say what I have been doing differently during COVID-19. First off, we had identified the health workers who were like focusing only on social mobilization activities, especially interpersonal communication with caregivers. I've trained many healthcare workers on interpersonal communication in collaboration with WHO and UNICEF at national level and subnational level. So initially, there were kind of wrong perception toward COVID-19 vaccines, even at the national level. At first, the big people were not even ready for vaccination. The presidents, the vice presidents, even other ministers, they were refusing vaccines. And the perception was like the COVID-19 is linked to interference of blood clotting. When someone is vaccinated with the COVID-19, then the blood is start clotting and then the person die. So from there, after we did communication and awareness on this, all rumors were dispelled, and ministers, presidents themselves, they were start accepting vaccines, and then they were all vaccinated. It was really, really difficult in the first month. When the vaccination was rolled out, after a few months later on, we have changed the mindsets towards COVID-19 vaccination. Up to now, the South Sudan country has vaccinated 2,800,000 and 52,000, that is like 33.8% of the coverage. So that's what I've learned so far in 2020 in relation to COVID-19 response. Thank you very much. Over to you.
Thank you, Samuel. So that sounds like a wide range of changes to adapt immunization services. What we're looking for are specific examples in terms of how you speak, how you carry out interpersonal communication with caregivers. But thank you for your contribution. Now, I noticed there are a large number of women in the Zoom studio, and we have not heard from them, Charlotte. So who shall we hear from? There is, let's see, there is, and again, keeping in mind the country equity rule, we are going to go over time. I've asked Charles Kakaire from UNICEF, our guide on the side, together with Deepa Risapo-Karel, if they're able to stay longer so we can hear their feedback after having listened to several stories. Let's go to Ari Netwe. B. Edward. So all of you are now able to unmute, and we'd love to hear from you on this question of interpersonal communication. Now, just to explain, of course, you can see the People tab is lit, which means that officially speed networking has started. You simply go to the hop-in and go to the People area, click on Join, and then you'll be able to meet someone else in Teach to Reach and be able to talk to them about this question of interpersonal communication. Charlotte, who shall we hear from? I see Ari Netwe.
Yes, thank you very much. Arenetwe Edward is my name, from Uganda, and I'm public specialist at a sub-regional level. Since 2020 COVID-19 surge, a lot of things have changed. However, what has helped me to move a big milestone is the attitude of health workers, my attitude and being a good example. More to that, a big political positive will can do a big magic to implementation of these health programs, especially during sensitization of health programs in COVID-19 vaccinations. Political leaders ranging from the national level, at the district level, down to the sub-county level, all people got involved, and we registered a big turn-up of the clients utilizing the services, and actually it helped us much, even to reduce on the transmission. The good political will really helps us and can help everybody if we are to move an inch, call it universal coverage in communities, provided you have given the right information to political leaders, church leaders, opinion leaders, and down the village health team, as you have them here in Uganda. They can easily change, and whatever you want to implement, you can easily implement it and get it over 90%. Thank you. Over to you. That's what I can share with you.
Thank you very much indeed. Now, Charlotte, I think there's been a series of men who've spoken. We strive for gender equality. Before we turn to our guides on the side, we need to hear, I think, from at least one woman who is, and there are a number of them in the Zoom studio. Who shall we hear from?
I'm inviting Benedetta Loco Musao. Benedetta, are you able to unmute yourself? Please go ahead and do so. I'm asking you to unmute. If not, we can turn towards Mary Goretti Otieno.
Yes, so we'll keep trying. We really want to
Charlotte,
honor.
sorry.
Yes.
Here's
okay, so we are going to start with Benedetta and then Mary Goretti.
Okay. Sorry, what?
So it's actually Loco
Charlotte,
Musa.
Sorry, what was the question?
So the question is,
multitasking.
Loco, since 2020, what has changed about how you speak with caregivers and other members of a community? What are you doing differently, and what's changed in the environment?
Okay, so my name is Benedetta Loco. I work for the National Vaccines and Immunization Program under the Ministry of Health in Kenya. So what has changed in the way we speak to caregivers is we've been having challenges in through defaulters in children who haven't completed their doses, especially for HPV and measles, rubella. So we have a defaulter tracking list where we include their names for the caregivers who haven't brought their children on the doses where they're due. Then we do a communication where we can do a call to them or an SMS, which does a reminder to them and ensures that they come for immunization session. Also, we are also doing our communication, demand generation activities in the communities where we go to like marketplaces or churches and communities where church leaders are meeting. We do like an outreach there, and we are able to sensitize the caregivers so that they can be able to come for their immunization sessions.
Thank you very much, Benedetta. That's a very clear answer. Let's go to Mary Goretti Otieno, and then we will close with our guides on the side to hear their feedback, their thoughts, their reflections, resources at the global level that may be available to help you with some of the challenges that have been described and adapting since 2020, focusing, of course, on interpersonal communication. I can see there's actually a lot of people who've just gone to the networking. So thank you for those of you who we invited to be in the studio with us, that you're staying. And we understand for people who just go to discuss these issues in one-on-one meetings. Mary Goretti Otieno, a warm welcome to you. Remind us who you are, where you work, what you do, and then tell us what you've changed about how you speak with caregivers.
Thank you so much, Mr. Reda and Charlotte. I'm Mary Goretti Otieno from Kenya, a lecturer at the university. I've been here since the beginning, that is 2020. I came across the issue of immunization in line of duty when I was collecting data in the year 2018, where I found out that in that community, the children had missed immunization for 8 months. And that day, they scheduled a focus group discussion, and the mothers never came. So upon inquiry, I was told that they are taking their children for immunization, since it is the first time it was, they were getting it after 8 months. So it really pained me, because that was very serious, because the same community, when they want their girls cut, they give out money and they do it very fast. But when it comes to matters of health, they are not concerned. So when I was now disseminating my findings, which was tackling barriers to girls' education, I talked to the youth about the need to talk to their parents so that the children are immunized in time. And also I took it upon myself to talk to the community leaders, the gatekeepers, to ensure that these girls and the babies in that community should be immunized so that they have quality children in future. Then now when COVID came, it found when we are now in communication with them. So again, I told them to use the youth in the area as volunteers to ensure that they don't give up still on immunization issues, which they were not taking seriously. And I also ensured that I still used the community leaders and also the organization, the government in place to ensure that they were not left behind. And that has helped me a lot, because having had Teach to Reach, coffee hours and all that, we learned a lot from other countries, and that has made me still not give up, but to use the elders, that is the community leaders, and the youth, because they are willing to change the status, especially the young men. They are very useful in changing the way the community have been doing things, especially what we call the practices which are not helpful to human beings. Thank you. I stop there.
Thank you very much indeed. So let's go back now to Charles Kakere and Deepa Rizal Pocorel from UNICEF headquarters. They're partners for this Teach to Reach 7 and specifically focused on interpersonal communication. Charles, there's been a lot of stories, of different stories said, multi-layered, complex stories that reflect the complex reality of the pandemic and immunization services within that. We'd love to have you pull out the gold nuggets in what you heard, how, and what you can feed back in terms of what tools, services, resources are available to help scholars, as we call them, Teach to Reach participants navigate these troubled waters. Charles, over to you.
Thank you very much, Rada. Just to begin by thanking the colleagues, Rada, for sharing the stories. There's a lot of good stories out there. So just hearing them and hearing about the challenges is a very good starting point in terms of the conversation around what it is that we could do to make this work better. Again, referring to the fact that, we are the people that the communities trust. And therefore, just being able to ensure that we uphold to that high expectation, that the community has. Issues around interpersonal communication can be complicated, but can also be very easy. A few things to note, again, as I mentioned at the start, that, interpersonal communication is both verbal and non-verbal. It's as much about information as it is about feelings or about ideas. So just being able to look at, those various components in terms of looking at this is very helpful. The issue around being able to listen to community concerns, when the caregivers come to us, what are some of the challenges that they have that we could then be able to see how we can collaboratively work together to improve those. A lot of them might not necessarily be communication related, but on this particular component, being able to identify those particular areas that the colleagues think we can work towards to be able to strengthen the good work that's already being done. In terms of resources, there's a couple of resources available on the UNICEF website around interpersonal communication. A guide for participants. We did share some of these. There's a few that are being adapted that we will also be sharing in the due course. But also just to mention, Rada, that we are hoping that in the coming year, we'll be able to engage with the Geneva Learning Foundation more to explore best ideas in terms of how we can reach out to this really large network of healthcare workers, and looking forward to hearing from them, in the continued networking session, especially with issues around the challenges that are out there with regards to interpersonal communication and what it is that we can do together to strengthen those elements to ensure again that we continue to maintain the trust that the caregivers have, in us, and also ensuring that this contributes then to the uptake of immunization. Thanks, Rada.
Thank you very much indeed, Charles. Now, Obed Philippe Nuobe has had a hand up. Before we close, we've met Obed, a young doctor from Ghana. In July 2019, he joined the Impact Accelerator, the first one we ever did at the Geneva Learning Foundation, working with already a network of nearly 15,000 people. Obed surprised us because we had told him, the Impact Accelerator, we do not expect you or anyone to implement their projects in the first 4 weeks of the accelerator. And that 2 weeks after the start of the accelerator, he sent us a hockey puck graph, or hockey stick graph, so a graph that suddenly goes up to showing a dramatic increase in coverage of a tetanus vaccine amongst pregnant women. Obed Philippe Nuobe, you've been through a lot since 2020 with the pandemic. Really pleased to hear you and to ask you to close this main plenary of Teach to Reach 7. Do introduce yourself and tell us, what have you changed about how you speak with caregivers, how you behave with caregivers and other members of the community?
Thank you very much, Rida. Hello, everyone. I'm Obed Philip Nobe, connecting from Agunam Kwanta, Ahanta West, in the western region of Ghana. I'm a public health officer. Indeed, COVID brought a lot of lessons for us. And when you look at the way we communicated and then the way we carried our activities, COVID actually changed the entire narrative. But Rita, I want to say that what we were able to do differently was, one, looking at the staff that deliver immunizations or vaccinations. We had to now look at the staff that are going to deliver the vaccines. Not all of them have to move out because the routine activities have to go on, and then the pandemic, responding to the pandemic vaccines to have to also go on. So we have to restructure our micro plan, real-time one that can be implemented, not just on a paper or a tabletop, but one that can be implemented to the community and to be able to reach our target. So we actually look at that. When it comes to the stakeholders that we're working with, prior to COVID, in fact, most often than not, when we are doing our campaigns or mass vaccinations, there are some key people who don't bring on board to communicate with them. So this time around, we saw ourselves in a realm of pandemic. So we have to, before we even send out letters to the various stakeholders we have identified, we have to first even meet them and tell them that we are working to resolve this pandemic. And they are very key to helping us achieve that objective. And in fact, for the first time that I have seen we going out to carry out vaccination session on COVID, that we have to bring the MC here, we call it the municipal chief executive for the municipal, into our meeting, our core meeting, to explain the rationale for the activity, and afterwards bring on board assembly members. And after that, we followed up letters to assembly members, the chief executive, to community leaders, chiefs, opinion leaders, religious leaders, very specific letters. But ordinarily, initially, we do not write these letters. And we have to meet them one by one in our respective areas, looking at the context and the issues we are getting about the vaccine hesitancy issues. And in fact, when we employed all these strategies, we saw our coverages always on the rise. Even despite the pandemic, we saw our routine immunization. We had to change some staff that should speak on vaccine hesitancy, and those that should not. We had to train some specially for that. And indeed, it has made a remarkable improvement in our indicator. Even in the midst of the pandemic, in our municipality, at a point in time, we always, whatever vaccines they will give to us, we will be able to utilize all the vaccines and even go for more from the regional health directorate. Even the just ended NOPV campaign that we conducted, the allocated one they gave to our target, we have to, based on these things that I've just outlined, liaison with them. And even sometimes we tell the communities, can you help us so that we can award community leaders that are making efforts to ensure that they bring their children to us to vaccinate during routine immunization. And then even the COVID, can we get community own people that are making effort, so that at the end of the day, you see the communities pointing specific people that help us. So in that context, we when we are rewarding, we bring in the municipal chief executive to go and award the community member who help us. And doing all these things and putting them together, we have seen that they are working. And when you approach it holistically, you get a lot of results. So that is what we have done so far. And EPI in routine activities and the COVID vaccines, we are on top as far as the region is concerned here in Ghana. Thank you very much, Rita.
Thank you, Philip. Obed Philip Nuobe, young leader, immunization, young doctor from Ghana. Now, we have extended this session. Many Many Teach to Reach participants have left the stage to go to the networking. We can see there's a lot of networking going on, which is what Teach to Reach is all about. But before we close, I want to highlight a few of the new resources that will be coming your way as members of the IA 2030 movement. So first of all, very pleased to share that we have just made available for the very first time this report based on the experiences and the case studies developed and peer-reviewed by 734 frontline health professionals. This is absolutely amazing. It's a must-read. All you need to do is to go to the link I just shared. I'm going to share it with anybody who's still left on the stage here. Request it. You'll get the full report. You'll be able to share your own experience and get the latest insights. It's really if you're looking for targeted interventions, key determinants that can help change the minds and behaviors of individuals, families, and communities, of course, there is excellent global guidance on the topic. This brings it home. This connects the dots between the global guidance and what actually works in the field, reflecting back on that global guidance. And then the major announcement that we made today is that on the 21st of October, the IA 2030 Movement Knowledge to Action Hub will be available for the first time. So this is a collection of works that have been produced through the collective effort of the movement. So 6,185 individuals joined this movement on the 7th of March. And what we're going to share on the 21st of October is the synthetic knowledge, learning, and action, what you've actually produced and done with the knowledge, because it belongs to you, because it is your experience, your expertise. And so this new hub is to help all practitioners. You've helped each other as active members in the movement, but many were not able to follow along. So this is also a way of giving back and sharing with everyone, including global practitioners, such as the colleagues from UNICEF who joined today, who are eager and interested to listen. So on the 21st of October, we'll be releasing this full set of 19 case studies and reports, and then we'll be organizing a process where every 2 weeks we can discuss and see what insights, what we learned from this incredible trove of knowledge, built, grounded in the expertise that you have as practitioners coming from all levels of the system. And last but not least, I'd like to highlight, if you go to the Geneva Learning Foundation's Instagram account, you will find another treasure trove that belongs to you, and that is the first photo exhibition of the movement for Immunization Agenda 2030. And you'll see here an incredible set of photos. And I propose that we end today's session with by looking at some of the new photos that were not, in fact, available on the 17th of June, had not yet been posted. I want to above all, thank you for the commitment, dedication, for the work that you're doing every day to keep immunization going, to improve your interpersonal communication, to figure out how we are going to build back better, to improve the individual, collective, global results, as well as starting with the results where you work. Thank you. And again, this is not the end of Teach to Reach. This is the end of a plenary. It's now time to go to the speed networking, where you'll be able to click on a button and meet with someone else who is participating in Teach to Reach. This is really, truly the best part of what we do here. But before you go, if you'd like to enjoy some of these photos, you're welcome to stay for a few more minutes. Some of you will, of course, be multitasking. We'll acknowledge the names. Dr. Amir Bashir from Pakistan, Awet Araya from Tanzania. And these photos were shared ahead of World Immunization Week 2022. We're going to do the same thing again for World Immunization Week 2023. We hope we'll have great partners such as UNICEF and others along with us for the 2023 edition. This is about how it takes people to make vaccines work. Abdul Bazit from Pakistan, shown here doing a data review. Odukaya Desoji Olatunde from Nigeria, demonstrating oral polio vaccination. Bukar Alhaji Ibrahim, this is your experience. This is the work that you do every day, but this photo exhibition is a unique window to see what the work of your colleagues looks like in other countries all across the world. Dr. Hemant Adhikari from India, interacting with children and parents of children eligible for immunization, documenting immunization coverage, and you can see the curious kids talking, taking random samples. Dr. Syed Anwar Hussain Shah from Pakistan, supportive supervision. Olatunde Ojehinde is shown here. This is a selfie, which is fine. Some people sent selfies. And it's important to see who is actually keeping vaccination, keeping immunization going, and how. Fatoumata Danso is a health service provider. She feels fulfilled when delivering immunization services. Hawa Umar Buhari from Nigeria, with a colleague from the nutrition section doing community outreach assessment. Kelvin Siafa Boima, vaccinating students with a COVID-19 vaccine. This was in April 2022. Olubukola Sojitaiwo, working as a national immunization officer, vaccinating, doing the work of the vaccinator after resolving non-compliance issues. This is in Nigeria. Dr. Isan Ghani, working in a refugee camp in Pakistan, monitoring polio vaccination status. Adeyunje Solomon Oyetoyan in Nigeria. All right, Abdurrashid may have just joined, but he finds it's a really interesting session. Thank you. This is the tail end. It's now time to go to the networking, but for those of you who are still in the stage, we'll keep it going for a few more minutes. Sandra Janice Misiribi from Kenya, a trainee in the Community Health Volunteer Program. And she says in her community, there are many challenges. Most women and girls give birth at home. They don't know the importance of immunization, and her work contributes to sensitization in the community. Over 1,000 photo stories were shared. So everything from selfies to detailed narratives, telling your story with you doing the telling and no one telling your story in your place. So we seek to honor that. You are indeed the people who make vaccines work. I'd like to applaud all of the people whose stories we've shown. Akech Buro, Kuol Akech from South Sudan, Dr. Muram Ali from Pakistan, Williams Triniboa, Education Activities, Christopher Amalu from Nigeria, Governor's Task Force and COVID-19 Containment, vaccinating clergies, Friday in Coma, showing the identification of zero-dose children in a fishing camp on the bridge on the Luapula River in Zambia. Weilin Ong, Northern Shan State's cold room in Myanmar, showing logistics management in practice. Ajay Patience, Islamic Orientation School in Nigeria, and Ikra Nursery and Primary School. And these are just a few of the 1,000 photos. Now, there's something that deeply disturbs me, is that so far the community has not shown their appreciation for their own work. So I'd like to encourage you. I believe Patience Ajay deserves more than 4 likes. I believe Charlotte is sharing the link to the Instagram feed so that you can go and add your likes, go through it. When the picture speaks to you, you can write a comment, you can tell us what you think, what it makes you feel. I'm going to again go to the, whoops, okay, I think I've lost it. Okay, yeah, go to the stage and actually post for the entire event a link. I'd like you to go right now, and there are so many of us here today, and so I would like you to go to the Instagram feed and choose at least one photo, to show your appreciation. And don't just leave a like, actually put in a comment. So let me just do that first, and then we'll do it for those of you, for the leaders of the Immunization Agenda who are in the community with us. You can see quite a remarkable, really, truly remarkable set of photos. Adamu Galadima Degona from Nigeria, Sifana Ahmed El Sayed Ahmed from Sudan, a mobile cinema show on the occasion of Vaccination Week when many of these pictures were taken, accompanied by recreational and drama shows and plays, conventions and prizes. Rohi Njie from River State, Nigeria, who says this is Rohi doing supportive supervision. Islamjar Akhtar Mohammed from Afghanistan, taking a picture of supervision again. And again, you can find not just the photo, but the story so you can understand what is happening here. Amos, Keaton, Ibrahim, I'd like to really ask you, if you have not done it already, and before we close this Teach to Reach main plenary, we've gone way over time, to go honor your colleagues, leave them a comment, and of course take a look at this incredible photo collection showing that it is indeed people who make vaccines work. Once again, thank you for having attended this plenary. And again, this is not the end of Teach to Reach. This is the beginning of the remaining networking sessions. You can go to the you can go at any time to the stage, or sorry, to the schedule here, and you can see networking 2 is going on right now. So, and then at the top of the hour, networking 3 will begin, where you'll be discussing with colleagues how to find the root cause of your IA 2030 Immunization Agenda Challenge. And then starting 1 hour later, you'll have open networking. So basically just an opportunity to meet, network, and learn, which is what we do throughout Teach to Reach. So just check the schedule if you're not sure what is happening or why. Once again, thank you. One more final round of applause, and wishing you well. We'll have many more activities. The launch of the IA 2030 Knowledge and Action Hub on the 21st of October, as well as many more activities, announcements planned for the next phase of the movement for Immunization Agenda 2030. We'll be working with leaders of the community, leaders of Immunization Agenda 2030 from all levels of the system to define what is that next phase going to look like. What next are we going to do together? I can't wait. Bye-bye.